11/1/2018.
And what day did your mom die?
11/20/18.
And what does the prescription say on the label that it's for?
Morphine.
Do you guys want to play it again?
Did the court want me to play it again? I'm sorry.
Huh?
Did the court want me to play it again?
No. It did look like she peeled something off. Why don't you go ahead and play it again since you're close?
11/1/2018.
And what day did your mom die?
11/20/18.
And
Are these the only pictures of the bottle?
There might be more that we have that we didn't mark. I think that's just the two.
But Your Honor, I would note that, those pictures depict what's on the bottle that are critical information. And the defendant, through counsel, has obtained the actual dispensing records for Mrs. Penix, and the dispensing records substantiate that prescription. And Ms. Leonard was cross-examined on the dispensing record. So it's clear that that prescription was prescribed for Melissa Penix, that it was filled multiple times, that it was for 15 milligrams, and that we sent a picture of the vial, of the bottle, to the defendant, supplemented it in January, and that if the court wants to strike the bottle because there's some fear that there was picking at it or one of the smaller labels picked off, that's fine. We're happy to go with the picture. I don't feel, or I would submit at this point that it's clear what all this means. That the lady had a prescription for 15 milligrams of morphine, that it was filled repeatedly. The defense sponsored that particular piece of information, and therefore none of the testimony should be stricken. If there is action to be taken in this matter, it would involve, sadly, questioning of the conduct of the witness, not striking the evidence or implying that the state of Ohio has done something untoward in this matter.
Ms. Manchin?
Thank you, Your Honor. I think the bigger picture is certainly not about the pill bottle. It is about a witness under oath put forth by the state of Ohio in a case against my client who's charged with 14 counts of murder that captured on video is clearly, and I say clearly now that everyone's had an opportunity to see it, taking something off the bottle. And as I'm sure this court noticed, she then proceeds to lower the bottle under the shelf. Importantly, there are some facial expressions that she makes while she's doing it. And when she further testifies and the bottle is below the shelf, she's literally looking down and doing something further. I think it is a bigger problem than the pill bottle. I think that we should be able to play this for the jury and also create forensically some still shots of her face. I think this goes directly to the witness's credibility or lack thereof. She was under oath and is actually tampering with evidence while she's on the witness stand. So I think we're beyond the admissibility of a pill bottle itself at this point, Your Honor. Thank you.
I'm looking at the pill bottle as we speak here, which is States Exhibit 33. Okay, there is the natural sticker, there's a secondary sticker, both look like they are not sticking close to the bottle. There is some writing that was added to the bottle, a circle of the 60, 2 dashes, and it looks like M something or other is written, but it's faded. Okay, there is another mark on there. It looks like, due to the nature of the label, it looks like some pressure was put on it. It's located right under the word daily, approximately an inch. Okay, I don't know if it was an alcohol tag, but we don't know. I did not see her do this live because I was at the wrong angle. Okay. Okay, I'm gonna take us under advisement. We don't have to do anything with it right this minute. Let's get the witnesses going again. I forgot the third issue. I'm guessing you guys are gonna be done with your case on Wednesday,
Tomorrow, Judge.
tomorrow?
We'll be done tomorrow morning if we can start and get through today. And then we will, I talked to Mr. Baez on Friday on the phone, and I suggested that instead of trying to, guess that we'd be done Tuesday morning, let's just, because we only have 6 witnesses left, 5, depending on the law testifies. So we intend to rest tomorrow, subject to the admission of our exhibits. So we got exhibits to go through, with a Rule 29 motion, and then, we can take the afternoon to take care of all of that. And then I suggested to Mr. Bias that they be set to go Wednesday morning would be our best bet.
Okay. Wow. If we can get through your case tomorrow, I figure we've got the better part of the day to do with the Daubert motions and the admissions. So maybe start them on Thursday would be the earliest. Is that possible?
Thursday?
Yeah.
I've already booked a ticket for Dr. Zivit, and that's the only issue.
When's his ticket for?
Wednesday, to be here, well, Tuesday, but to testify for Wednesday morning. That's the only.
Well, he's not necessarily subject to the Daubert. Okay, his whole issue revolves around his first report. So I could technically do the Daubert hearings on Thursday, because we'll probably have to have them by Zoom contact us for testimonial purposes. Were you guys going to file a response to their motion?
The issue that we have is, I don't know how the court feels about this, but it's our position that this is a frivolous motion as it relates to Dr. Patel. And I could lay out the reasons why I would think this is.
Okay. Dr. Patel's side, I'm putting him in the category with the Daubert hearing.
Correct.
Dr. Zivit is the one that I'm concerned about because we have 2 reports, may have erroneously got over, but we have 2 reports that contradict themselves in a way or have additional information considered. Were you guys going to respond to that motion, or are we just going to argue it later today?
If the court wants us to respond to it, we certainly can. Like we had stated in chambers, we think this is analogous to the state's expert. And the court dispensed of it rather quickly in that context. That's why we had responded to it previously. It was our position that it is virtually an identical issue.
Well, I'm not seeing it the same way. Here's my problem. Your guy has the absolute right to remain silent. And I have an expert that exposes that right. Okay? That's my big concern here, because One, how do I stop the state from attacking it? At that point in time, do I have a problem? Because does that force him to the stand? And I want to avoid that. It's his absolute constitutional right. I want to avoid that issue. But I can't very well solve the cat getting out of the bag issue either. That's why I'm looking for some insight on a response, because I'm not, doctor should not testify. The problem is what happens once he testifies and gets into cross. Is it fair game for them to utilize the other report, collateral constitution, whether they've been waived or not, those types of issues? I just want to make sure it's clean before we put him on the stand. So that's what I'm after.
Understand?
Okay?
Yes.
You know, it's a difficult situation, but I can't unring the bell. They've got something in hand, and what do we do about it?
Understood.
Okay? Okay. We ready to start then?
Yes, sir. No?
Yeah.
Well, I'm sorry, our first witness is gonna be Derek Dreyer.
Okay.
I don't know whose name it is. Jose, can we approach very briefly, Your Honor?
Yeah.
Okay. So, are you, sir?
Your Honor, one last thing. As the court knows, I asked permission to go do my other cases this
Yeah.
morning. Thank you.
There was a motion on the original document against One has a showing of the defendant's tattoo on it. There was no ruling on it yet.
got lots of rest over the weekend? Good, come on up. Take your long walk there. Okay, I need you to raise your right hand. You solemnly swear to tell the truth, the whole truth, and nothing but the truth, so help you God. Go ahead and make yourself comfortable there. You got a mic there in front of you that's been pushed away. So you move that kind of the middle there. You need it up in the book to hear you. I just moved the book in front of that strap. There you go. Okay, I need you to state your name for the record and spell your name for my court reporter, please.
Sure. Derek Dreyer, spelled D as in Delta, E-R-E-K as in Delta, R-E-Y-E-R.
Can you guys hear him? Okay. Try to keep up the voice a little bit. This plexiglass around you kind of muffles things. Okay, thank you. Ms. Sawyer.
Yes, Your Honor, before we proceed any further, we do have a stipulation with the defense that evidence would show that Dr. Husel has on his right arm a tribal tattoo. We will also submit that in writing to the court.
It is so stipulated.
Okay. You may continue on then.
Thank you, Your Honor. Sir, where did you go to college?
I went to nursing school at Mount Carmel College of Nursing.
All right, and a little bit loud, having
Mount Carmel.
attend Mount Carmel College of Nursing, sir.
I started there in 2013 in the summer. I was in like an advanced program,
Okay.
and I graduated from there in May of 2014.
Tell me what you mean by an advanced program. What does that mean to us?
Yeah, so I had my high school education. I didn't do overly well in high school, so it took me a little while to get into nursing, which was what I wanted to do with my life. So I started at Ohio Dominican University, just to get my foot into a college. Did some undergraduate general classes there, and then once I was able to show that I could keep a 3.0 on a 4.0 scale, I was able to get admitted to Mount Carmel College of Nursing. And so in the summer of 2013, I took my entire junior year of nursing school in that summer time period. So it was advanced.
Okay. When did you graduate from nursing school then?
It would have been May of 2014.
And did you become a licensed or a registered nurse at some?
It would have occurred, I believe, probably it was in the summer of 2014. I'd say maybe August.
And after that, did you become employed as a nurse?
I did.
Where at, sir?
Mount Carmel College of Nursing. I'm sorry, Mount Carmel West Hospital. My apologies.
And when approximately did that job start?
I took that job in August of 2014.
And were you assigned to any specific division of Mount Carmel West?
So I started on the third floor at Mount Carmel West, which was medical surgical with a palliative and hospice oncology focus.
Okay.
I worked there for about a year prior to graduating nursing school as a basically nursing assistant.
Okay.
So it kind of was a nice little transition into the nursing profession.
And once you became licensed, did you switch jobs?
Yes, I did.
Where did you become employed then?
So when I became licensed, I stuck on the same unit, the third floor at Mount Carmel West. I worked on the third floor for about a year and a half.
Was there at that time any particular shift you worked?
I basically worked night shift.
And you said you were there for about a year and a half, so did you then switch to a different floor?
I did.
When did that occur? Were you working any particular shift at the
Shift.
and you said primarily 99% of the time. What about the other percentage of the time?
I enjoyed working, enjoyed being a nurse. So I would go in, for example, I'd pick up shifts. I would come in maybe at 3 p.m., which is a day shift, and I would work like a 16-hour shift. So I basically, that other 1%, it's just random, like helping out the unit for staffing purposes.
Now, when you first took your first job after becoming an RN at Mount Carmel West, what type of education or training did you get for that job specifically?
Type of education that I received for that job, primarily on-the-job training. You know, we had preceptorships on the third floor. I would follow a nurse who had been there for a little while, kind of learn the ropes, know how to do all the random things that you kind of read about in nursing school, but you still have to get experience in doing it. So preceptorship was the basis of my training.
What about when you switched to the ICU? Any additional training at that point?
When I switched to the ICU, I received a shortened preceptorship. I think typically a new graduate nurse that comes to the ICU, they would get maybe 12 to 16 weeks of training. Since I was already a nurse for a while, I believe that I got around like a couple months of training, following a preceptor, learning all the ins and outs of the ICU.
How did that job with the ICU differ from your previous one with Mount Carmel West?
Different. I would say the biggest difference is just the patient, just the type of patient. You know, we on the third floor, I would have not critically ill patients. And then when I went to the ICU, the big difference was you have these critically ill patients. It was an open ICU, meaning we received all kinds of patients that were critically ill. Could have been cardiac or surgery, trauma, medical, neurosurgery. So the biggest difference I would say is just the patient acuity.
Tell us a little bit about your typical day when you got to the ICU. How many patients would you deal with?
Typically, you'd get two patients, sometimes one patient. If the patient is what they call like a one-on-one patient who's extremely ill. Extremely ill. There's certain patients by the hospital policies that they would make a one-on-one patient. For example, if you had a patient that was on a Prisma machine, which is continuous dialysis, typically those were just one-to-one nurse to patient because there's a lot going on. So I'd say usually two, sometimes one. There'd be nights too where you would get just two very sick patients that should be singled, but it's all kind of based on staffing too.
What doctors did you work with on the night shift at the ICU?
So when I started on the night shift in the ICU, I would work primarily with Dr. Hagris, Dr. Husel. We had a medical resident that worked, that would cover some of the ICU patients. When I started, Dr. Husel, Dr. Hagris, they would cover the patients that weren't the clinic patients, I believe. And then the resident would cover the clinic patients.
What's the difference between those?
I would say the difference is the insurance status. You know, if the patient's seen by an attending physician, such as Columbus Inpatient Care or an independent attending, they typically have private insurance. And then Mount Carmel being a teaching hospital, they have clinic where they provide care to patients that might not have insurance. So that's kind of what I understood as a differential, how the patients were split up. And that was kind of when I first started. And then they ended up getting rid of the medical resident.
Okay.
So I primarily worked with Dr. Husel and Dr. Hagris.
Do you remember when approximately the residents were gotten rid of?
I don't.
Okay, that's fair. Medication. If you needed to get medication at the ICU, tell us a little bit about how that you would go about getting that.
So a few different ways. If it is a scheduled medication, the medication could be dispersed to the patient's room by the pharmacy. So it'd be available for you there. Possibly it's scheduled, it's not kept in the pharmacy, it's kept in the Pyxis machine, so you go get it from there. Sometimes we would do override of medications commonly in the ICU. for various different things. And also, sometimes you'd have a situation, at least in my experience, where pharmacy has to bring the medication up to me and the staff at the bedside.
And when you say override, tell us what you mean by that.
So by override, generally speaking, going to the Pyxis, pulling up my patient, getting whatever medication I might need. It could be just a wide range of medications. It could be IV fluid bags. It could be sterile water where there's not a patient order in for that sterile water, so you still have to just go in and override it. Or it could be, in these cases, getting the medications and these urgent situations to, take care of the patient.
And when you're talking about an override, does that mean you're pulling it without pharmacy approving it in advance?
Yes and no.
Okay, tell me what you mean by that.
So in my experience going through this process, I had palliative withdrawal that I did, and it basically, for example, orders put in by the physician or by myself for a certain amount of medication. That medication dosage changes. I go to pull it out of the Pyxis. That conversation and this experience for myself has been approved by the pharmacist. It just kind of shows as an override, but technically not. So you have that type of situation.
Okay.
Or you have an override where it's not approved immediately before, in my experience, shortly after by the pharmacist.
Now, you indicated when you entered an order, where do you get the orders for medication from?
The prescriber, so as nurses, we don't prescribe, so we would have to get a verbal order. Typically in ICU, it's common to get just verbal orders from the physicians, and then we put it in.
Are you aware of any policy at Mount Carmel West regarding when you would be allowed to obtain medication from the Pyxis machine via an override?
At the time, no. I'm aware of the policy that's there.
Okay. Sustained. We'll leave it at the no.
That's-
Ladies and gentlemen, disregard the rest of the answer.
Thank you, Your Honor.
I assume that's your objection.
Yes, sir.
Mr. Dreyer, I'm going to direct your attention now to some of the victims that you had involvement with in this case.
Okay. To the alleged victims, you
The
mean?
alleged victims, Your Honor.
Okay.
And I'm going to start with Brandon. And sir, I'm going to first show you what I've marked for identification as State's Exhibit 5I. And let me enlarge this a little bit for everybody to see. Can you tell us what patient this is regarding?
Brandy McDonald.
And if you can see, let's enlarge a little bit further. What was her admit date, sir?
It reads January 11th, 2018.
And her discharge date?
January 14th, 2018.
Now, Mr. Dreyer, I'm going to ask you just up front, do you have any independent recollection of Miss McDonald?
No,
So just what the medical records would show to you?
correct.
Was there any objection to just putting them up there so we don't? Thanks. All right. So I want to direct your attention, and again regarding Brandy McDonald,
Correct.
I want to direct your attention to this order, the middle of the page. Can you tell us about that, Mr. Dreyer?
Middle of the page, there appears to be an order for midazolam or Versed,
And how much?
2 milligrams.
And what date and time was this at, sir?
Looks like this was at 6:53 in the morning on January 14th, 2018.
And how was this administered?
IV push.
To the best of your recollection, do you remember or not whether or not this was the time she was being intubated?
Independent recollection,
or based upon review of the medical records?
yeah, when I reviewed the medical records, it appeared that she was being intubated.
And based upon your review of the medical records, do you recall whether or not this 2 milligrams of midazolam alleviated any pain that she might have had during the intubation process?
I don't recall.
That's fair. I also want to talk to you about, again, regarding Brandy McDonald,
Correct.
and I want to talk about this order right here. What is that for?
This appears to be an order for 10 milligrams of vecuronium IV push.
And what date and time was this?
This was January 14th, 2018, 7 a.m.
Do you recall what vecuronium is for?
It's a paralytic medication that is given for different reasons.
Is that something that you would typically see in the ICU with a ventilated patient?
Some type of paralytic, correct?
Mr. Driver, the next patient I want to discuss is going to be James Allen. And I'm first going to show you what I've marked for identification, States Exhibit 8F. And what patient is that regarding, sir?
James Allen,
And what date was he admitted on?
May 24th, 2018.
And what date was he discharged on?
May 28th, 2018.
And I want to talk to you just very briefly about the time period you had with him, again, regarding James Allen.
Correct.
And I want to direct your attention to the bottom of this. What is this typically? How would you describe this to us? Is the patient having pain and there's a list?
So this, it's confusing for me to look at because this is
Paper.
a paper, you know, in the computer, it's obviously formatted differently. This would be part of an every 2-hour check on the patient that you would go through. And one of the things you would assess, you know, is the patient having pain. That's part of the kind of the serial every 2-hour checks.
And when did you see Mr. Allen?
It appears by the documentation, I saw him at the beginning of the night shift on May 25th, 2018 at 7:30 p.m. and 9:45 p.m.
And what was your finding regarding whether or not he was having any pain at that time?
I inputted no for both times.
And just switching to the next page, again, James Allen,
That's correct.
did you continue with him as a patient during the remainder of your shift?
That's correct.
So that would be May 25th going into May 26th?
Correct.
And what was your finding regarding whether he was having any pain at that time?
Looks like I put in no for all the other checks for that shift.
And based upon this, does it appear you had any further contact with Mr. Allen after that date?
Correct.
Mr. Dryer, I'm next going to direct your attention to Beverly Scherzinger. And showing what's been marked for identification as States Exhibit 3E. Can you tell us what patient this is regarding?
Beverly Scherzinger.
And what date was she admitted on, sir?
She was admitted October 2nd, 2017.
And what date was she discharged?
October 9th of 2017.
And do you remember Ms. Scherzinger?
I have some independent recollection and then, you know, from the charts as well.
Okay, tell us first what your independent recollection of Ms. Scherzinger is.
Independent recollection, I remember going to a code blue on the normal nursing floor that was called on this patient when her heart stopped. I remember assisting in that code blue with other hospital staff. I remember bringing her up to the ICU, and I remember basically getting her checked into the ICU, trying to resolve some of the issues that she was having with her blood pressure post CPR. I remember a couple family members that were on the normal nursing floor, and that's about it. Independent recollection, I would say.
Mr. Dreyer, in your practice, when a patient would be brought to you at the ICU and you would become your patient, would you review their past pain levels or anything else regarding the patient?
If you had time,
Okay.
I would say.
Do you remember whether you reviewed that with Ms. Schertzinger?
I remember having help from the charge nurse, getting her hooked up into the system. I remember helping Dr. Husel do some interventions, put in some monitoring lines to kind of give her special medications and try to fix her blood pressure. I don't remember doing a deep dive into the chart.
Okay. So I'm going to first direct your attention to, again, regarding Ms. Schertzinger,
Correct.
and we're again looking at is pain level acceptable. Does that look accurate to you?
Correct.
All right, and I'm going to take it to the bottom of that page. Did you at some point check on the pain level with Ms. Schertzinger?
It appears that I charted at 10 o'clock on October 9th, 2017.
And what did you find at that point regarding any pain level?
Doesn't say that I put in a pain level. It says there's like a note here possibly, this T1014.
All right, and I'm going to take you over to, again, Ms. Schertzinger,
Correct.
and T1014, what does that note say?
So that is the note to show that I use the CPOT scale to assess her pain.
So going back, if there is just a dash there, what would that tell us?
In my practice, as best as I could, that would tell me that I didn't put down a pain score at this time for various reasons, probably.
Okay. What were some of those various reasons you might not do that?
So with this patient, she had the CPR done on the normal nursing floor. She was intubated, was given paralytics to facilitate the intubation, to get the breathing tube down into the lungs so we could try to stabilize the patient. And in this case, when the patient's on a paralytic or coming off of one from the intubation, for example, it's really hard to always put in that pain scale. So I would say that when I first got this, I remember, when I first got this patient, she was coming off of that paralytic, and so that's probably why, one of the reasons why I put that note score there.
And directing your attention to this page again, Ms. Schertzinger,
That's correct.
and at the top you see is the patient having pain.
No.
All right. And what is your entry at 10/9/17 at 22?
No entry for a pain score.
And the note below that you mark?
Patient unable to self-report pain.
And do you recall why that was?
So I think that kind of ties into what I was trying to describe. Just with certain situations, if if I have time to sit down and throw in some documentation, I would say, patient's unable to self-report pain. So she's on the paralytic. I can't assess, I guess, at that time what her pain level is. So I left it blank.
Okay, that's fair. Do you remember your next note regarding Ms. Schertzinger?
I don't.
Okay. And again, regarding Ms. Schertzinger?
Correct.
And I'm going to direct your attention to your note at the bottom. What date and time is this?
So this note was put in on October 9th, 2017 at 11:25 p.m.
And what do you note here?
I write patient with PEA arrest on 5 tower, which is the normal nursing floor, 2 rounds of CPR, directing you to see the code notes. Palliative withdrawal performed at 23:20 per Dr. Husel's order. after talking with the family at the bedside with as-needed sedatives for Dr. Husel.
So this is what we've been, palliative withdrawal. What does that mean to you?
So palliative withdrawal is basically getting to a point in the patient's care where the goals of care is to be comfortable or not continue the aggressive measures. So it's stopping these life support measures.
Okay, hold on one second. You okay? Okay, just making sure.
Do you
You're
recall
doing
what,
so well so far. Okay.
do you recall, Mr. Dryer, what medication was ordered on Ms. Schertzinger at this time?
She was ordered 500 milligrams of fentanyl and I believe 4 milligrams of Burke.
And I'm going to show you those orders again, Ms. Schertzinger.
Correct.
And is this the order for the 500 micrograms of fentanyl?
Correct.
How was this to be administered?
IV push.
And what time did that order take place?
Looks like 11:24 p.m.
And do you know whether or not this was approved prior to pulling it out of the Pyxis machine?
It appears a couple minutes after.
Okay. And then again, Ms. Schertzinger,
Correct.
and what medication order is this for?
This is for the midazolam or the Burke 4 milligrams IV push.
And what date and time?
Looks like 11:24 p.m. is when it was administered.
And who ordered both the fentanyl and the midazolam?
Dr. Husel.
Was that via a written or a verbal order, if you remember?
Don't remember.
That's fair. What did you do once you received this order and pulled the medication, Mr. Dryer?
Don't remember specifics. I just remember, I could just talk to what my practice would entail,
Okay,
which would be pulled medications.
what would you have done from there?
Yeah, going to the patient's room, getting them drawn up, getting them prepared for the patient, doing a final review, making sure I have the right doses and that were ordered by the prescriber and administering the medication.
And did you administer that medication, both the fentanyl and the midazolam, to Ms. Schertzinger?
Yes.
Mr. Dryer, I next want to talk to you about Francis Burke. And I'm showing you what's been marked for identification at States Exhibit 6D. Can you identify that patient for us?
Francis Burke.
And what date was she admitted to the hospital?
She was admitted on January 13th, 2018.
And what date was she discharged, sir?
January 14th, 2018.
Did you review any prior medication that she may have received, if you recall?
I recall reviewing medications that she was being infused with.
Okay,
That's about all I recall.
all right. And I'm going to direct your attention again, Francis Burke.
Correct.
And what medication is this for, sir?
This is for fentanyl. It's like 50 micrograms.
And what date and time were you involved with the administration of this type of medicine?
It appears January 13th of 2018 at 7:20 p.m. Looks like I have my names in the chart there.
And any remembrance of whether or not this alleviated Ms. Burke's pain?
I don't remember giving her any fentanyl at this time. I don't know. It looks like I'm modifying something in the chart,
Okay,
and up underneath the top line there, order for fentanyl, it says the order status is discontinued. I'm probably just maybe like reviewing the orders,
okay,
so I don't recall giving any fentanyl at that time.
all right. But you do recall reviewing it and seeing that she at least at some point had received 50 micrograms? According to the,
According to the charts, yes.
okay. And also showing you, again, Francis Burke?
Correct.
Do you remember reviewing that order?
According to the chart, it appears I reviewed it.
And what is that for, sir?
So this appears that this is being discontinued. It appears this was ordered by Dr. Klosser at some point, and the action here is to discontinue it.
And how much is that for, the midazolam?
1 milligram.
All right, and I want to show you, again regarding Francis Burke,
Correct.
do you see this first column where it talks about pain score?
Correct.
What does her history show us at this point?
Specifically speaking to the pain score, it appears that she has several zeros, indicating no pain per the chart. And then my score at, looks like 2 minutes after midnight on the 14th of a 10 for pain.
All right, and I'm going to direct your attention to your progress note regarding this, again regarding Ms. Burke.
Correct.
And bottom of the page, what date and time is your progress note made?
My progress note is entered on January 14th, 2018. Looks like 4 minutes after midnight.
And what are you doing at this time?
I am, looks like Dr. Husel, I'm documenting Dr. Husel's talked with the family where the decision had been made to withdraw care for the family and Dr. Husel, and I'm performing that palliative withdrawal, giving the medications that were ordered, moving the endotracheal tube, and then paging the chaplain as well.
And this is going on, if you recall, do you recall the time that you gave the 10 pain score?
I believe it was a couple minutes after midnight.
Okay, so this appears to be when you gave the 10. Would that be accurate?
Correct.
Why did you give a 10?
So I do have some independent recollection of her clinical picture. She was very, very bad in the bed. She was writhing around in the bed, posturing, clamping down on the breathing tube. She had a very massive brain bleed that was causing all these seizure-like activities. Just looked very poor on my assessment.
And prior to that, 50 micrograms of fentanyl and the fentanyl seemed to relieve any pain she had with the zeros that are above it.
Per the other nurse's notes, you could say that.
Okay. What medication, and again, I'm going to direct your attention, Francis Burke.
Correct.
What medication did you give her at that time doing the palliative withdrawal?
I administered 1,000 micrograms of fentanyl IV push. Looks like 2 minutes after midnight or 3 minutes after midnight.
And at whose order?
Dr. Husel.
All right, Mr. Dyer, the last patient I want to talk to you about is Jeremy, Hodge. And this is State's Exhibit 7E. Can you identify the patient for us?
Jeremiah Hodge.
All right, and I think it's Jeremy is what we've been told is how it's pronounced. Sue, I think she went by Sue at the hospital.
I believe I've seen that
All right.
somewhere.
And what date was she admitted to the hospital?
She was admitted April 1st, 2018.
And what date was she discharged?
April 1st, 2018.
Do you have any independent recollection of Miss Hodge?
I do.
Tell us about that.
Miss Hodge came up to the ICU from the cath lab where patients go when they're having various issues with the heart, could be a heart attack. She comes up to the ICU, bed 7 of the ICU. I have help from a colleague to help her get checked in, meaning we hook her up to all the monitors. The cath lab nurses are pushing her. Basically, you go from the basement up into the elevator, you go down the back of the ICU, probably about a 5-minute little trip. I remember them pushing her into the room. We get her pulled over to the bed, get her hooked up to the monitor, and she already does not have a pulse. She's in what we call PEA.
PEA means what?
It's pulseless electrical activity.
Okay,
So it appears basically your heart has electrical function and muscular function. So your muscular function in this case stops. It's not pumping. It's not pumping the blood and oxygen to the body, but that electrical system is still at least appearing on the monitor that it's intact. So you're seeing a heart rhythm.
okay.
So I vividly remember that, getting her hooked up, calling out a code blue, performing more CPR. I remember a large family presence. That's about it.
Okay. I'm going to direct your attention, again, this is Jeremy Hodge, Miss Hodge?
Correct.
All right. And you make some notation here as you're going through. What do we have first? What's the first area that we're looking at here?
So the first area points to a heart rate, a respiratory rate, and then a systolic blood pressure, which is one of the numbers in your blood pressure, your top number.
Okay. And what do you note in that note on April 1st, 2018 at 21:20?
It appears her heart rate is 94, her respiratory rate's 18, and her blood pressure is 108.
And the next set of that we're looking at, what's that telling us?
The next set just completes that blood pressure measurement. It's the lower number of the blood pressure, appears to be 58.
Okay. And what about underneath that?
Underneath that, it's the pulse oximetry percentage, and so the pulse oximetry percentage is the amount of oxygen in your blood, appears to be 91%, and then your device FiO2, which is the setting that's on the breathing machine. How much oxygen are we giving her? We're giving her 100%.
All right. And then next, we've talked about this a little bit. This is the pain score.
Correct.
What do you note on the pain score at this point?
I note a 0 on the pain score at 2120.
And underneath that, we've got pain intensity scale, see below. Do you use the CPOT?
Correct.
Again, regarding Ms. Hodge?
Correct.
And I want to talk about the Glasgow Coma score. What does that mean to you, if you remember?
I remember it's a scale that is used to assess the patient's alertness.
And what do you note in regards to Ms. Hodge?
Don't remember what a 3
That's
correlates
okay.
to, but I note that I put a 3.
All right. And I want to direct your attention then to, again, regarding Ms. Hodge
Correct.
and your nursing progress note.
Correct.
What does that say? Tell us.
It reads, patient is in PEA on arrival to bed 7, 4H07.
And what's going on at this point?
We're performing 3 more rounds of CPR, which is ACLS. It's advanced cardiac life support. ROSC, which means we had a return of spontaneous circulation, so we did get a pulse back. And then the last couple sentences speaks to the Palliative Withdrawal. It says Palliative Withdrawal per Dr. Husel and family at bedside. Fentanyl and Versed given. And I just say see doctor's note for further.
And this is at what time? on April 1st?
It appears to be 9:36 p.m.
And I just want to go back very quickly. What pain score did you give her just a few minutes before that?
At 9:20 p.m., my pain score in the chart started at 0.
All right. And again, regarding Ms. Hodge,
Correct.
what medication did you give in the course of doing the palliative withdrawal?
For the palliative withdrawal at 9:35 p.m., she was given 800 micrograms of fentanyl, as well as 6 milligrams of midazolam or Versed.
And that was via IV push?
IV push, yes.
Who ordered that medication, sir?
Dr. Husel.
And did you in fact give that medication to Ms. Hodge?
Yes.
And I don't think I asked, the medication with Ms. Burke, did you also give her that medication at the
Yes.
time of palliative withdrawal?
Yes.
Mr. Dreyer, during the time period you worked in the ICU, how would you describe your relationship with your other coworkers?
Yeah, so my relationship in the Mount Carmel West ICU, I would describe it as a really kind of a family environment in a way where the only way we're getting out of this shift is if everybody's working together. And that's the only way we're going to provide the best patient care. I never really had any issues other than, you might get one or two people that might be more of kind of independent workers, but for the most part, everybody worked together because you had to. You need to rely on all the nurses and whatever doctor you have on staff, respiratory therapist. It takes a village, and that's how I would describe kind of my experience at Mount Carmel West ICU.
You trusted your coworkers, the other nurses you worked with?
Yes.
What about your relationship with Dr. Hagris?
I trusted Dr. Hagris, enjoyed working with him.
What about Dr. Husel?
Also trusted Dr. Husel, enjoyed working with him. Learned a lot from Dr. Husel about various things.
And did you have a relationship with Dr. Husel outside of work?
Yeah, we were friends. We were all, I was so busy working, going to school. He was busy working. Every once in a while, we'd have a, small outing or something if we got around to it.
And when you say we, who would be included in that?
So it could be me, Dr. Husel, our wives, other nurses. We'd go to dinner. We just very kind of things outside of work that coworkers do, I guess.
The medication in these 3 palliative withdrawals, had you ever had experience with any other doctor in palliative withdrawals?
Let's rephrase the question, sustained.
Sure. Other than these 3 palliative withdrawals, had you ever participated in other palliative withdrawals in the hospital at Mount Carmel West?
By independent recollection, I can't remember any.
Okay. No, no independent recollection of ever doing anything with Dr. Hagris?
I don't recall doing any palliative withdrawals with Dr. Hagris.
Based upon that, did you have anything to compare the type of medication ordered for these 3 individuals to anything else?
Just, I would say, as a nurse, based on my previous experiences working in the ICU with Dr. Husel,
Okay.
so I definitely had that kind of
Okay.
compared with things.
Thank you. No further questions, Your Honor.
Cross.
Jose, do you want these up there? Let's see, the order I did them in. Yep. There you go. getting my water.
Good morning, ladies and gentlemen. Good morning, sir. How are you?
Good, are you?
Great. This is our first time talking, right?
Correct.
We've never had a chance to even speak on the phone.
Never.
Okay. My name is Jose Baez, and I represent Dr. Husel.
Nice to meet you.
Pleasure. So I want to start off where Ms. Sawyer started off, and that was showing you Miss Brandy McDonald's medications. You were asked about this medication. That's Brandy McDonald, and I'm showing you States Exhibit 5I. Do you see that?
Correct.
And is this the paralytic that you were shown?
Yes.
Okay. Now, the time of that is at 7 a.m., correct?
Correct.
And she wasn't extubated until later on in the night shift, right?
I don't recall.
Okay. But she wasn't extubated in the morning, right?
Correct.
And you're aware that through Mount Carmel's order set that you're supposed to terminate the paralytics 30 minutes before extubation, correct?
Correct.
And this, in fact, was for an intubation, correct?
That's how I read the chart, correct?
Okay. So it was never your intent to mislead the jury into thinking that Miss McDonald was on paralytics while being extubated, correct?
Correct.
All right. Next, you were shown Mr. Allen. And you were asked about pain scores. You can have that. You were asked about these pain scores, correct? I'm showing you, I'm sorry, for the record, 8F, states 8F. You were asked about these pain scores where it has your name. Do you see that?
Yes, I do.
And that's on the 25th, right?
Yes.
And that's 3 days before Mr. Allen was extubated, correct?
Don't remember when he was extubated.
All right, let me just get you, I'll show you Joint Exhibit 8, page 848. I'm sorry. Okay. Do you see that there?
I do.
And this, of course, is a nurse's note on the extubation, right?
Correct.
So, and the date on that is what date, sir?
5/28/2018.
So you're asked about pain scores 3 days before his extubation, correct?
Correct.
Okay. Again, it was not your intent to mislead the jury into thinking that he had 0 pain scores.
Sustain is the question.
You were not asked about pain scores at the time of extubation for Mr. Allen, correct?
That's correct.
Next, I believe you went over Miss Schertzing. And you were asked about, and I'm showing you States Exhibit 3E. You see that?
I do.
And that's for Miss Schertzinger.
Yes, it is.
And her admit date was 10/2.
Yes.
And of course, her discharge date, which would have been the time or the date she passed away, was 10/9, correct?
Correct.
You were asked about medication she was given on 10/9, but a bit earlier, correct?
Correct.
You were asked about her pain scores. I'm trying to find that page, if you give me just a moment. On 10/9, and you noted an 8, correct?
That's correct.
And then there was these other pain scores that were mentioned. Do you recall that? During your direct testimony that you were asked about?
I don't.
Oh, you don't? Okay. Bless you. I want to ask you on Ms. Schertzringer, you were aware of some pain that she was in, correct?
Correct.
In fact, you were also asked, I'm sorry, this is what I meant to point out. You were asked about the paralytics that she was given during intubation, correct?
Correct.
Not the extubation.
Correct.
And as it relates to Ms. Schertzringer, why don't you share with the ladies and gentlemen of the jury the pain that you believe she was under based on her clinical picture?
Sure. So the pain Ms. Schertzinger was under came from several different sources. She came in with back pain from a fall. She came in, had some testing done, found cancer in several different areas throughout her person. She had a liver biopsy done that day of her code event, and her abdomen was filling up with blood. Throughout the day before she coded, the doctors on the floor were treating her nausea and pain. Bleeding continued, filling up with blood. So she had that going on, and then comes the CPR, and that's additional pain on top of all that. So quite a good amount of pain. And then I remember, after reviewing the chart, she's in this pain from these different sources that I've explained, but she's also been given that paralytic from the intubation. So she hasn't been given any pain medication from the time of CPR. So has a good amount of reasons for pain.
And that's, I think that pretty much sums that up. Let me ask you, let me move on to the next patient, which was Frances Burke. You were asked about Miss Burke's pain scores being at 0 and then climbing up to 10. Do you recall that testimony by Ms. Sawyer? Things change rather quickly in the ICU, do they not?
Correct.
And in fact, you noted in your testimony that she was clamping down on the bed.
Correct.
And she was suffering pain at that time, correct?
Correct.
Okay. Now, this is not something you made up, is it? You didn't make up this pain score of number 10.
Okay, you got two different things going on there. Sustain it, re-ask your question.
Sure. When you noted a pain score of 10, you weren't making that up, were you? It was based on your observations, correct? Okay. And that's exactly what you testified in direct for the prosecutor, correct?
Correct.
And that's still your testimony, of course, now, right?
Correct.
Okay. Now, moving over to Ms. Hodge. Ms. Hodge came in, this was the one where there was no pain score noted. But you had a distinct recollection of her clinical picture. Do you remember that?
Yes.
Okay, and I believe you were shown her pain score, which I believe was at a 0 at the time, correct?
Correct.
Now, It's also your understanding that she had coded several times throughout the day, right?
Correct. She had upwards of an hour of CPR.
And you know that based on your training and experience to be very painful, right?
Correct.
In fact, as a result of which, the likelihood of broken ribs is substantially high, wouldn't you say?
I'm gonna sustain at this point in time.
Based on your training and experience, when a person receives,
Your Honor.
I'm sorry to finish the question.
Sorry.
Based on your training and experience, when a person receives an hour of CPR, as a treating nurse, you operate under the assumption that ribs are broken, correct?
Objection, Your Honor.
Okay, I'll permit it.
Yes. Hour CPR that's a long time. A round of CPR is typically around 2 minutes. So an hour worth, and just based on my experience with the CPR, you break ribs, but they can also, I've also seen lungs be punctured. And so yes, very painful.
Now, you mentioned things happen rather quickly in the ICU. Sometimes, are you familiar with back charting?
Yes.
And sometimes, or I should say, a majority of the time, you have to back chart because you're busy treating the patient, correct?
Correct. You try to do in my practice, specifically with this case, Mrs. Hodge, my focus is to, at this point, take care of the family, take care of the patient, and go back and put in my charting as best I can. In this case, with all the CPR going on, it's hard the patient's condition changes minute to minute, and it's hard to go and chart minute to minute, like all the different changes. So you just do the best you can, and that's kind of what I would do as a nurse, just do the best I can with the charting.
So fair to say you're not treating the patient and coming over here and taking notes as you're doing it, right?
Correct.
Because your main concern is the patient and saving her life.
Correct.
Now, I want to ask you about, you were asked about the relationship that you had with Dr. Husel. The number of times that you saw Dr. Husel outside of work, fair to say was just once or twice?
Correct. I think twice.
Okay. So 2 times, and how many years did you work with him?
2+, I would say, 2 years.
Okay. Once a year, you would see Dr. Husel outside of work.
Correct.
Okay. Now, I want to ask you about your HR interview and a statement you made in your HR interview. I'm going to let you know what it is, and then I'll ask you about it. You mentioned Dr. Husel, Physician of the Year, nominated many times. Feels like nurses have been taking a big hit with this situation. How did pharmacy director not see this over 6 years?
Okay, let's approach. Mr. Baez.
Sure. So, sir, I wanted to ask you, I'm going to break down the statement you made and then ask you about that specific topic, and then we'll go a little further, okay?
Okay.
All right. You stated, how did pharmacy director not see this over 6 years? As based on your working at the ICU, it's your understanding that pharmacy had often verified many of these orders, correct?
Correct.
And it's also your understanding that sometimes there was an override, but in fact, there were conversations with the pharmacy and it only looked like an override, correct?
Correct.
So tell the ladies and gentlemen of the jury how sometimes you would have communication with the pharmacy, but it still shows up as an override.
So my experience, for example, my first palliative withdrawal that had occurred with Dr. Husel, we had a patient who was a planned palliative withdrawal from the day shift, and I came on at night. We were waiting for family to arrive and had a conversation with Dr. Husel just to receive my orders for the medications. And the pharmacist intervened on the medication, specifically on the dose. And I guess just to kind of make it more clear, the order was put in initially for 1,000 micrograms of fentanyl. The pharmacist intervenes. That order's been put in. She intervenes. We end up coming to a dose of 500 micrograms of fentanyl due to, I was told it was a drug shortage out of Puerto Rico. It was like a hurricane or something. And so we agreed on 500 micrograms of fentanyl, or the prescribers agreed on 500 micrograms of fentanyl. And when I go to the Pyxis to pull out that 500 micrograms that the pharmacist has just talked to me about and said, give me the green light, you're good to go, it shows as an override because it's just a formality. I'm pulling it from the 1,000 microgram order that's already in there, but I'm only getting 500 micrograms, so it shows as an override, but technically isn't. So those conversations sometimes are on the kind of inside.
So it's fair to say that the medical records don't always tell the complete picture, correct?
Unfortunately not.
And in fact, sometimes it may appear that the pharmacist is not involved until later, when in fact they are, based on phone conversations, correct?
That's correct.
And you also stated, how did attending physicians not see this? They would have had to write discharge notes. As a nurse practicing in the ICU, you rely on a multidisciplinary approach, correct?
That's correct.
And you relied on the attending physicians writing these discharge notes and doing their job thoroughly, correct?
That's correct.
And that's why you brought it to the attention of human resources at Mount Carmel.
Yeah, I think anytime that I've done if I've had, we're all human, so if you ever make a human error, the hospital is going to tell you about it. And so I think my mindset was,
Now, I wanted to ask you about Ms. Hodge. You're aware that there were lots of family members at bedside, correct?
I remember that, yes.
And if it were to be testified that they weren't allowed in until after the extubation, you would disagree with that, correct?
Yes, I disagree.
Just want to double check if I can have court's indulgence to see if I have anything further. You, in dealing with Dr. Husel, fact, when it came to dosing, he would often explain his rationale.
Objection, Your Honor.
Correct?
Sustained.
Did you ever have an issue questioning Dr. Husel on any of his orders?
No, never.
And in fact, tell the ladies and gentlemen of the jury what Dr. Husel will do if you question one of his orders,
Objection, Your Honor.
without telling us what he said.
Okay, go ahead.
So, working with Dr. Husel, and I compare that to other doctors that I've worked in other ICUs throughout Mount Carmel, for example, it was always a kind of comprehensive conversation if I needed to, if I was wondering why we're giving this medication, there's discussion between me and him, he's explaining why we're doing it, providing some education. That was always open. It's always an open communication, and it just led to basically me to just enhance my learning, I guess.
And if you question the order, were you asked what you would feel comfortable ordering?
I had some very rare situations with Dr. Husel where, we're all so busy, and I've questioned an order, and by question, I mean, I've kind of brought some additional information to him, be like, hey, did you see this with the patient? And I do recall there was never any, shutting down the nurse, not just shutting down the nurse. I'm the doctor. This is what we're going to do. Sometimes there was actually what I suggested, I guess, or not suggested, but kind of just my thoughts would end up being what the treatment would be. So there were very few occasions where my information that I would bring to him would, he would change what we're doing.
Okay. Now, there was a unique patient base at Mount Carmel. It served a unique community, correct?
Correct.
And you had seen even 70-pound little old ladies with lots of pain.
Your Honor.
In that.
Okay.
I'll just move on, Judge. That's fine. I'll withdraw the question. Now, you were interviewed by law enforcement, correct?
Correct.
And you, in fact, brought to law enforcement's attention that you had seen studies that actually high doses of fentanyl can prolong life, correct?
Yes, correct.
And this is a study that you actually saw. That was I guess, a medical journal.
I believe so, correct.
And now I want to ask you about the conversations Dr. Husel would have with families at the time of terminal extubations. Did you find these conversations to be thorough?
Objection, Your Honor.
Okay, let's rephrase. Sustained.
Sure. Based on your training experience, did you find these conversations to be thorough?
Objection, Your Honor.
I'll permit it.
Yes, I would say they're thorough. Just his practice and in my experience wouldn't assume anything. It was kind of just, here's what's going on, here's what we've done, here's your options, and as thorough as possible.
Did you ever see him encouraging families to try and pull the plug?
Objection, Your Honor.
Sustained.
Did you ever see him encouraging families to extubate these patients?
Objection, Your Honor.
Did you ever? I'll permit it.
No.
And was it based on your experience and what you actually witnessed, did Dr. Husel give the family all of the options?
Objection, Your Honor.
Okay, sustained.
If in fact and I only want to discuss the ones who were present, during the palliative withdrawals that you were present for, if Dr. Husel failed to give any information, would you have supplemented?
Yes,
And you would have felt free to do so.
yes, and that's just part of my nursing role, you know, just trying to inform the family. You know, if, again, the doctor, they explains, you know, as much as they can. Medical jargon is very kind of technical and it's hard to understand. So sometimes it's good to have more than one person to kind of reiterate or maybe even discuss something further. And so, yeah, that's that was part of my role.
And, I can have just one moment, Judge. I'm sorry. I think I'll wrap it up. Did you ever witness any doctor giving percentages as it relates to how someone may live, whether someone may live or may not?
Objection, Your Honor.
I'll overrule it.
I've never heard any doctor use that type of language.
So you would never hear that someone would say 99.9% sure of it.
Objection, asked and answered.
Did you ever hear that expression?
Thank you.
Put your objection to the record.
I can. Did you ever hear in any of the conversations that you participated in, anyone mention anything about being brain dead?
Objection, Your Honor.
Overruled.
I've never heard that, and just from my experience working with specifically Dr. Husel, that
Okay, wait a minute. You never heard it, so that ends the answer.
Now, Mr. Dreyer, each and every time you participated with a palliative extubation, Dr. Husel, it was always your intention to give these medications to alleviate pain, correct?
that's correct.
It was never your intention to hasten any death
That's correct.
or to kill anyone.
Correct.
Right. And if you had ever noticed anything that you didn't agree with, that you would have stood up and told someone, correct?
That's correct.
And it doesn't matter the fact that you saw Dr. Husel 2 times in 2 years outside of work, correct?
Asked and answered. Sustained.
Would that have discouraged, would the fact that you went out and outside of work 2 times in 2 years with Dr. Husel, would that have influenced you in any way to not report anything? I have no further questions.
Redirect.
Thank you, Your Honor.
You guys okay over there? Okay. Anybody need a break? Huh? Okay, hang in there.
Mr. Dreyer, on cross-examination, you were questioned about the HR interview that occurred, I'm assuming, after all of this,
I think there was a couple of them.
okay? And are you currently with Mount Carmel West still?
No.
When did that end?
I was terminated July of 2008. 2019? July
Okay.
2019.
And were you called before the nursing board also for your involvement with those 3 cases?
I was. There was 4 that I was called for.
Okay. Now, you've talked about Dr. Husel being thorough in regards to these 3 palliative extubations. You and I had spoken before, correct?
Correct.
And when I asked you the question of, did you remember anything that Dr. Husel said during the course of those palliative extubations, you told me no, you had no memory.
Specifics? Yeah.
Okay. No further questions, Your Honor.
Okay, you may step down. Thank you. Let's take that break for 15. We'll bring back another witness. May go a little bit past 12, but we'll make it work. Okay?
All right.
Have a great break. Remember the admonition.
So, good morning, everyone. Just wanted to fill you guys in on a couple things. Sounds like the prosecution might get done today or tomorrow. The case down in Tennessee. Just a judge talking about something.
Thank you.
Okay, so Tennessee v. Mosley. It's a murder trial. It's a guy accused of stabbing 2 guys up in a bar. Claims it was self-defense. That's a jury selection today. If it's still going in jury selection into tomorrow, we're going to wait. But once that trial starts, we're going to go over to that one. Dr. Husel is just a great space filler because it's always on, but we will probably switch over. I just want to give everybody a heads up. So that's kind of where we are with things. Anyways, hello, everybody. Hope you guys all had a great weekend. If you're new, I am the disembodied voice because my laptop camera doesn't work. My name's Sean Martin. I'm an attorney. I'm in the Cleveland, Ohio area, and I, practice criminal defense law. And I run this channel. Kale. Yes, Husel's the new Durst. Yeah, except they're not wearing all the goofy face shields. So I run this channel. Normally you can see me. If you want to see what I look like, you can look at the other streams, or if you want to go look at some of my older videos I put out, those are available. Good morning, Chuck. Good morning, Roxy, Gabby, Cameron, Robin, Matthew. Who else is here right now? Critter. I think there's a bunch of people here that. Calais. Calais, I don't think I've seen you before. If you've been around before, I apologize, but welcome. Thank you for being here. If you like this place, please like and subscribe. That's always appreciated. Zulu, how are you doing? Welcome back. Trying to see who's all been here so far. But yeah, guys, we'll be starting that up. Oh, Kat, how you doing? Yeah, like I said, we'll be doing Tennessee versus Mosley. I'll put some information up on a community post about it. Basically, he was in a bar. He claims these guys attacked him, and he stabbed them and murdered them in self-defense. I think it's a little different because usually you don't have too many stabbing cases nowadays. Most people get shot. Also, I just think we'll try it. If it turns out to be more interesting than Husel, great. If it turns out to be a snoozer, well, then we can come back to Husel and take a nap and snooze through the medical procedures. It all depends. We'll just see how it shakes out. Today, I thought I was going to be a lot busier than I am. It looks like I still will be this afternoon, but this morning things cleared up, so I poked my head in to say hello. So anyways, how are you guys doing right now? let's see actually what we got going on here. Boom, boom. So let's see. Yeah, there's still a jury selection, it looks like. See if I can find that. Let's see if we can see it here. So he's out of Nashville if you guys were trying to want to find information ahead of time, but I will you know what? I'll just put this up now so we can watch it. We got 15 minutes. Well, Chuck, I hope. Oh, Chuck, I'm sorry you're here at the hospital. Hope you're feeling better. I hope they figure out what's going on and get you straightened out. That's not a good thing, but stay positive. That's all I can tell you right now. As much as I am a doctor, I'm not that good of a. I'm not that kind of doctor. But yeah, I have a feeling you'll be all right. So anyway, we'll just kind of cover Mr. Mosley real quick. So as you can see, there's a picture of our young Michael there. And he's involved in a triple stab. He killed 2 men outside of a bar 2 years ago. He's alleged to have murdered Clayton Bethard and Paul Trapini. Their other friend was seriously injured. The police and the prosecutor are claiming that he made unwanted moves on a woman, and she was friends with the 3 guys. And when they stepped in, a fight broke out, and they went outside, and that's when Mosley pulled out his knife and did his thing allegedly, and he pled not guilty. So that's really it. I know there's probably a little bit more, but that's kind of the 30,000-foot view of what we're looking at. So it should be very interesting what's going to happen. I mean, this could go a lot of different ways. This is one that I think's got some legs. It's very interesting. I think Critter pointed it out to me, so I just want to give a shout out to Critter. This should be a very interesting one to look at. The issue is I think we got to find somewhere where it's being streamed. I don't know if this is going to be I don't think Long Crime's covering it. The other thing is apparently he did offer to plead guilty to some lesser felony charges, but the prosecution said, no, we're not doing that. So, so let's see here. Did you guys happen to watch the Oscars last night or see what happened at the Oscars when Chris Rock got slapped? Yeah, where's the live feature for some of these channels? Court TV is covering. Oh, Court TV is covering it. Huh. I'll have to see if I can get that on. So I was checking their YouTube feed and it wasn't showing up. Huh. Thank you, Lori. I appreciate it. Yeah, it's not showing it. It's not showing it as a live feed, so I'm a little. Trying to figure out where it's at. Lori, I would say it looks staged, but when Will Smith is sitting in the audience and you listen to the other countries, um, un, 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 on unedited feeds and uncensored feeds, Will Smith drops a ton of F-bombs. And at first people think it's a joke, but you hear the whole crowd go silent. He definitely, that wasn't a joke. Which I think is hilarious because the only person who's victimized Will Smith is his wife. Yeah. Yeah, I think we will, but I'm just trying to make sure I don't cause any problems with them, and I don't want them trying to come after me. But yeah, we'll try that tomorrow and see what happens. Well, Chuck, he didn't do anything wrong. He was making a... Will Smith can get mad that, yeah, his wife treats him like shit, but going and attacking other people is not... that's not the way you handle that, because, let's face it, Jada is the reason why Will's life is a disaster. You know, and it's the Oscars. Ricky Gervais has done it before and made some pretty brutal jokes. Like, oh no, he made a joke about her hair being short. Oh no, that was the joke. But yeah, for Will to run around screaming about it like a lunatic was that was a bit much, I think. Now it's funny. Nobody's going to get in trouble out of it, but you know that's the advantage of being a celebrity. But yeah. Oh, so it's on courttv.com, huh? I don't understand why they don't use their website. So we'll try it and see. I mean, I don't necessarily want to. I'll use it if I have to, but I try to stay away from the big timers so they don't come after me.
While you're taking care of...
Oh, I did forget to mention, apparently Mosley has a criminal record that includes assault, armed robbery, and among other offenses. Apparently he's also got a prior assaulting a woman at a Walmart, which none of this is, it makes Mosley look good. Oh, so he's already okay. Yeah, Mosley was already on bond for attacking another woman in 2016, and I'm sorry, was it in 2019? He beat this woman and it stabbed her in the eye with a key. He's doing 12 years in prison, so he's already going to prison right now. Yeah. So Chuck, yeah, Will Smith definitely overreacted. I mean, if your wife has cucked you, you don't get to get mad at people making fun of things like that. That is not acceptable to me, at least.
First Alert Live Radar is powered by Auto.
Oh no! Shut up! Shut down sound. All right, guys. Well, I'm gonna have to find somewhere we can watch this because I don't know if Court TV. I mean, we'll try to watch it there, but I don't know how long that'll last. Should probably have a backup plan ready to go. So. You know what? I may just put this up on YouTube real quick so you guys can watch the. If we can watch this uncensored. Where's the good one here? Let's see if I can bring this up.
Hardest job tonight? Javier Bardem. Oh, you know.
All right, good. Here we go. I got this. If you guys want to see, there's that issue with Court TV, but we got a second. We're gonna watch this and go back to Husel. So here you go. Let's watch Chris Rock get thumped.
You got the hardest job tonight? Javier Bardem and his wife are both nominated. Now, if she loses, he can't win. He is praying that Will Smith wins. Like, please, Lord. Jada, I love you. G.I. Jane 2, can't wait to see it. All right?
See, he's already laughing and she doesn't like it, so that's why he comes up there. Which is bullshit.
Oh, wow. Wow. Will Smith just smacked the shit out of me.
Keep my wife's name out your fucking mouth.
Wow, dude.
Yeah.
It was a G.I. Jane joke.
Keep my wife's name out your fucking mouth.
I'm going to, okay? Okay. That was a greatest night in the history of television. Okay.
Now, I agree. Yeah, he made fun of her medical condition a little bit, but it was more of a G.I. Jane joke. And honestly, if you're a celebrity and you're at an award show, that's not the place for Will Smith to have soggy tampons. Oh no, they made fun of somebody. Ooh, woo, woo, woo. Big mad, big sad. Like, you're a fucking celebrity. You better be able to handle your shit. I mean, there's that, and also, Jada treats him like shit all the time. So, apparently that's too far. He slapped him. He slapped him like a sissy. He didn't punch him. I mean, I will say Will's big enough he could have laid into him, but yeah, he just slapped him. So, yeah, I mean, that'd be battery or assault, depending on where you live. Misdemeanor, no felony. So, all right, guys. Well, I'm going to go grab Channel 10 and put it back up. Oh, if it was non-celebrities, well, you wouldn't get that close to the stage, but yeah, you'd be getting tackled for like trespassing, disorderly conduct, disturbing the peace, assault and battery, you know, any number of things they would be trying to pin on you. They probably treat you like you're a stalker. Jada rewarded Will at home. No, she doesn't. She steps out on him all the time, Kat. Like that's a whole thing there. No, she treats him like shit. So she didn't reward him. I don't think. She let him watch is the reward he gets. But oh no, Chris Rock would be having like stalker restraining orders against you. You'd have a ton of problems. So there'd be a million. Would any of that rise to a felony? I don't think so because it's clear he didn't suffer any serious injury. So I don't think that would have changed a whole lot. You know, and also you'd probably be getting your ass kicked by a bunch of security guards, Matthew. Oh, I agree, Gabby. I think that's a fair argument. You know, it's one. You know, he might say it's one thing if my wife treats me like shit, and she does. Well, she does it on that show she has on Facebook. Like it's very well known how their relationship is. Like she treats him like crap a lot. But yes, I understand the argument of like, hey, only she gets to treat me like shit. Who do you think you are? That's a very weird argument to make, but I understand it's an argument to make. Yeah, the Red Table, yes. I watched one or two of those, and they do not treat Will very well on the one I saw him on the first time. Hi, Toxic. Hope you're doing well. But yeah, I'm kind of curious to see what you guys think. I thought it was interesting. I don't think I'm going to do a breakdown video of it because it's like you slapped and you got hit. That was really it. So we'll probably talk about it again on Thursday just because it's some quick filler and you know it's very nice and open. Gabby, that's true. We don't know how Will treats her off camera, but it's widely known that, you know, I'm not sure why he stays together with her because he's got the money, but hey, some people like to put up with all kinds of crap, and I should know I put up with all kinds of crap before myself. So, you know, there for the grace of God go I. Oh, we're about to start. All right, guys, I'm going to go quiet for a bit. I've got a phone call to make coming up, so we'll be running to lunch, and then I'll talk to you guys about the game plan a little bit more. They might, Gabby. They might.
DAVIDAUSTIN.
Let's slow it down. to get it out, we just need to be able to understand. Okay? Do it again.
Oh, we're getting a choppy feed.
There's trash in there. Now, you talk perfectly fine when you're over here with me. Let's light them up. Let's over here, okay? Okay, this is
Thank you, sir. Where did you grow up, Mr. Austin?
I'm sorry.
Where'd you grow up?
I was all over the United States and overseas. I was an Army brat.
Okay. At some point, did you meet a young lady named Bonnie Austin? Bonnie. Wasn't Bonnie Austin at the time. When did you meet Bonnie? Let's start there.
I met her in West Virginia.
All right. Were you living in West Virginia at the time?
No, I lived in Columbus.
All right. When did you meet Bonnie?
It was, if my memory serves correctly, was July in 70, or pardon me, 82, I believe it was.
1982?
Yes, it was, no, it was March, by March of 82.
All right. You went out on a date with Bonnie?
Yes,
How many months later were you two married?
we got married in July of 82.
All right. How long were you two married?
We were married 35 years.
All right. Where did you two live after you got married?
We lived here in Columbus.
What did you do for a living?
I was a truck driver.
All right. Did Bonnie work outside the home?
She was a waitress.
All right. Did you two have any children together?
One.
All right. Was that a son or a daughter?
Pardon?
Did you have a son or a daughter?
A daughter.
All right. And did you raise her here in Columbus?
Yes.
All right. Back in September of 2018, was Bonnie having any problems health-wise?
Yes.
Tell us about the problems she was having that day.
She had the day, she was having trouble breathing. So she did a breathing machine. She tried to get her breathing. She didn't do no good. So we called the emergency squad. The emergency squad came.
I want to stop you there. You said you had a breathing machine at home?
Yes.
Had this been an ongoing problem for Bonnie?
The breathing, yes.
All right. Had she been to the hospital before for this?
Yes.
Had she been recently to the hospital before for this?
I can't remember the last time she was there.
All right. Did she have a diagnosis related to her breathing that you were aware of?
Yes.
Do you remember what that disease was called?
What it's called, I can't remember exactly.
Fair enough. But it was an ongoing problem and she had a breathing machine at home.
Yes.
And did the breathing machine take care of it usually?
Majority of the time, yes.
Did it take care of it on September 18th?
No.
So you called the squad. What happened next?
They came, they checked her out, said they had to take her to the emergency room.
All right. What happened next?
I told her that I would see her at the emergency room. Excuse me. As they were taking out the door, taking her to the squad, I said, "Okay, honey, I'll see you at the emergency room." And then she was talking to the ambulance people, emergency room squad people, and they took her out to the squad, getting her set up. I noticed that they were started doing CPR to her.
All right. What happened next?
When they were doing CPR, then they started took her to the hospital.
Loaded her on and got her to the hospital.
Yes, sir.
What hospital did they take her to?
Mount Carmel.
Which Mount Carmel?
Mount Carmel West.
What did you do next?
I got in my car and I went to Mount Carmel West.
Did Did you call anybody in your family?
I called my daughter.
Okay. Does your daughter have any children?
She has 3. She has 4 now, but 3 at that time.
All right. Did she have a son at that time who was a almost grown or grown up at that point?
Yes.
What's his name?
Caleb Clark.
How old was he back in 2018?
He was 18, I believe, at the time.
All right. And just so the jury knows the family relations, was Caleb with anybody? Did he have a girlfriend?
He had a girlfriend, yes. He had a girlfriend, yes.
What was Caleb's girlfriend's name?
Tammy.
Tammy. All right. So what happened when you got to the hospital? How long do you think it took you to get to the hospital, and then what happened?
It just took a few minutes for me to get to the hospital because we're not that far from it.
Okay.
And then we got to the hospital. We had got in the emergency room. We're waiting to find out what was happening.
Now you say we, are other family members there with you in the emergency room?
There was my daughter finally got there because I called her and told her that what had happened. My grandson got there. His girlfriend. My girlfriend's there.
Okay. You said my girlfriend's father?
I said girlfriend. Let me start again. My grandson's girlfriend's mother and father were there.
All right. So I'm going to stop you there. Let's write this down. So you're David, right?
That is correct.
And your wife's name is Bonnie, right?
Correct.
And you and Bonnie have a girl. What's her name?
Laura.
Laura. And Laura had some children.
Correct.
And one of those children was, what was the boy's name?
Caleb.
Caleb. So Caleb is your grandson, right?
Correct.
And when you say we, is Laura there at the ER with you guys?
Laura was there. I called her and she came, yes.
Was Caleb there?
Caleb was there, yes.
All right. Now, when Caleb showed up, and he's young, but is he an adult at this point, 18?
He was 18, yes, he was.
All right. And you said he had a girlfriend?
Yes.
All right. You said her name was Tammy?
Tara, I'm sorry, Tara.
Caleb's girlfriend's name is Tara.
Yes, I'm sorry.
So Caleb is your grandson, and his girlfriend is Tara. Now, did Tara bring any of her family to the ER? What's Tara's mom's name?
Tammy.
Tammy. That's the Tammy.
What
Okay. I get it. It's all right. All right. And then Tara's dad was there too. What was his name? What is
I don't remember his name.
That's okay. All right. So that's the group that's there at the ER that you remember?
Correct.
All right. What happens next?
We're waiting at the emergency room, waiting to find out what happened to my wife. Eventually, the emergency room doctor or the nurse, I can't remember who came out, they told us to come. No, there was a doctor came out and told us to come in, that my wife was ready. They told us, don't worry about the tubes and wires that were on my wife because that. I said, don't worry about it. I've seen her with tubes and stuff here before. And then he said that she had a collapsed lungs, which they had to inflate, and that her heart had stopped several times. I can't remember exactly how many times it was. But her heart was beating somewhat on its own, but with the help of the machine, it was okay. And her lungs were breathing on its own, but they had to have the machine to help him. And that he was going to send her up to ICU. I said, okay, no problem. But he said that he believed that she was going to make it. She was going to be okay, that he believed she was going to be okay.
All right. What happens next? What time of day is this? This is all on the same day, right?
Yes, it was later in the evening.
Okay, so we're still on September 30th?
Pardon?
We're still on that same date,
On the
September 30th?
Yes, sir.
So what happens next? You're told this, are you standing physically in the emergency room?
Yes, I was next to my wife, yes. And,
Were you able to talk to your wife?
no, she was unable to speak or do anything.
Okay. What happens next?
We went back out to the emergency room, the waiting room, and he sent her up to,
I'm standing back here because I'm trying to.
he went out and he sent her up to ICU, and me, my daughter, let me stop again. My daughter said, okay, since she's gonna be okay, she left to go home and take care of her other kids. And me, Caleb, his girlfriend, and her mother and father went to ICU.
Okay, so at the ICU now, it's you, Caleb, Caleb's girlfriend, Tara, and Tara's mom and dad.
Correct.
Do you remember where you had to go? Is it on the same level as the ER, or did you go in an elevator? How'd you get there?
Elevator.
All right. What happens? I want you to look back in your mind. You're getting off that elevator. What happens next?
There's a waiting room there in the ICU. And so we're waiting around for the ICU, waiting for someone to tell us what's going on so we can go back in and see my wife.
Okay. Was it crowded in that waiting room? Were there a lot of people there?
As far back as I can remember, I don't believe there was hardly anybody at all.
Do you remember what time of day it was? You said it was the evening. Is it late evening, early evening?
It was late evening. I think it was around 11 or somewhere in that area, 10, 11, somewhere in that area.
Okay. So you're waiting. Do you remember, could you give the jury an estimate of how long you think you waited for someone to come out and talk to you?
No, it wasn't very long.
Okay. What happens next?
Dr. Husel came out and told me she was brain dead, that her heart was dead, her lungs were dead, the machines were the only thing keeping her alive. What do you want us to do? And then I told him that she didn't want to be like a vegetable. She wanted the living will. I had a living will. She wanted to have a living will. I told him that she didn't want to be like that. She didn't want to be no vegetable. And I said, is there any chance she'd come out of it? He said no. I said, well, she said she didn't want to be no vegetable. She wanted to have it taken off. She didn't want to be there. And I asked him one last time, I said, is there any chance of her coming back? Again, he said no. I said, pull the plug.
Okay. Now, looking back in your mind, do you remember those words, or is that your own interpretation of those words of what Dr. Husel said when you said she's brain dead, her heart's dead, etc.? What? Are you sure those are the words he used, or is that
Those
just what you're
are his
thinking?
words. Those are his words. That's exactly what he said.
If that had not been told to you, would you have agreed to what in your
No,
words,
I
pull the
would
plug?
not have.
Okay. What happened next with you?
Me, I took off. I went off, took a long walk through the hospital. I couldn't stay. I had to go walk off somewhere. I had to go be by myself.
What was your emotional state at that point?
I couldn't. I couldn't do nothing.
Do you remember how long you took this? You went on a walk for?
I don't know. It was quite a while. I went to the hospital. I don't know where I went. I don't know how long it was. The only person I seen throughout the hospital was one of the ladies in there. I told her I didn't want to talk to nobody. Just leave me alone. I don't want to talk to nobody. And the time I got back, my grandson told me she was gone. And that was it.
So you weren't there when they pulled
No.
the plug? You weren't there when your wife passed?
No.
What happened next?
I left the hospital and then I had to go to get her funeral parade started.
So that was all on the same day that she came into the hospital on September 30th of 2018?
Yes, sir.
At some point later that year, or maybe at the beginning of the next year, did you receive a call from the hospital?
Yes, sir.
I don't want you to tell us what they told you, but based upon what you were told regarding the care of your wife, Bonnie, did you contact a private attorney?
I was told,
No, not what you were told,
What he was told.
Sustained.
not what you were told, but you got a call. Did you get a call?
I did get a phone call from
Okay.
Mount Carmel.
And then based on what you were told, without telling us what you were told, but just based on that, did you go and get a private attorney? Did you
Yes.
get an attorney?
Yes,
Did you sue the hospital and everybody involved in this?
yes,
All right. Is that is that suit still pending?
yes.
Thank you. I have no further questions.
Ms. Menashe?
What? Oh, I'm sorry. Just one thing. Nothing further. Thank you.
Ms. Menashe?
Thank you. Morning. I'm Diane Menashe on behalf of Dr. Husel. Sir, and I know you have a right to be present, but I'm just curious. Have you been watching this trial from inside the courtroom?
Most,
Okay, were you here in court prior to your testimony today when the nurse testified?
just outside, I didn't come inside, I was outside.
So I want to ask you some follow-up questions if I can. Have you ever been provided with the medical records of your wife?
Yes,
And did you review those?
I didn't review them, I gave them to my lawyer, I didn't.
Okay. I'm assuming you know that in the ambulance, not only did she have the code at your house, but she had another code when she was in the ambulance. Are you aware of that?
I don't know how many codes she had, I don't know.
Okay, so you don't know that she actually had 2 codes before even getting to Mount Carmel West?
I don't know exactly how many, no.
And then do you not know that she had 3 more
Objection,
codes?
Your Honor, as to this line of question.
Sustained is the format of the question. Rephrase.
Well, tell me if you know, based upon your conversations in this case and your direct knowledge, do you know if your wife had 3 more codes when she was in the emergency room at Mount Carmel West in September of 2019?
I don't know exactly how many she had, no.
Okay. And that's where you haven't been provided that information.
Objection, Your Honor.
Sustained.
Ask Mr. Austin how many codes she had.
Objection, Your Honor.
Not permitted.
No, so let's go before she got the ambulance. If they were trying to put her in there, they were giving her CPR.
Come back, I'm sorry, I didn't hear you.
You called the ambulance, correct?
Yes,
And you witnessed, did you not, as they were putting her into the ambulance, that they were doing CPR on her?
no, they did not do CPR until she was in the ambulance.
Okay, but the ambulance was parked at your house, is that right?
Correct.
And you were able to see what was going on inside the truck?
In the ambulance, in the emergency squad, yes.
And the emergency personnel that were giving the CPR to your wife in the ambulance, those were males, were they not?
Yes,
And they were giving your wife the chest compressions.
yes.
And I know that you testified that your wife had had vascular or heart issues for some time. Is that correct?
As far as the heart, no, it hadn't been all that long.
Okay. So when they were giving her CPR, based on your experience as a person, I'm assuming you knew what that meant when you saw that they were giving her CPR.
Yes, I did.
And then you got to the hospital. When you arrived, she was already on the ventilator, was she not? Tube down her throat?
Yes,
Okay. And so that had happened between when you saw her at the house and when you arrived at Mount Carmel West.
yes.
When you see her in the emergency room, just so we're clear about the floors, that's the first floor as you walk into the hospital?
Yes,
Is that right? You talked about at the time that your daughter, Laura, was there with you during when you were on the emergency room floor. Is that correct?
I'm sorry.
When you were, you called your daughter to come into the hospital?
I called my daughter before I left, yes.
And I'm assuming that you called her because you knew it was serious?
Yes,
And she came to the hospital?
yes,
And then, did you assume that she also called her children because Caleb arrived?
Caleb was with me,
Caleb was with you at the house?
correct.
And then was Caleb's girlfriend Tara with him, or did she come separately?
I can't remember.
Can you remember if Tara came with her parents, or did they come separately?
That I can't remember.
And I think, sir, in your deposition, you said, and understandably so, that some of this is really fuzzy. Do you remember saying that?
I can't remember.
So Laura's there in the emergency room with you.
Yes,
Asked about a list of family members that were with you. Do you also remember Elisa Stover, a chaplain that was with you in the emergency room?
I understand there was, think there was a chaplain there. I can't remember. I remember talking to a female chaplain. It's the only one I can really remember.
Okay, because then it seems as if, or do you remember that there was a second chaplain in the ICU named Carrie Miller? Do you remember her, sir?
I remember there was a female chaplain, the only one I can really remember.
Okay. And then do you remember your police interview on February of 2019? Do you remember the date of that interview?
No,
Do you remember about the conversation you had in the ICU with the doctor? And you said that you didn't remember his name?
on the emergency room?
No, in the, when you had a conversation about ending, end of life with respect to your wife.
It's Dr. Husel.
Okay, do you remember saying to the Columbus Police Department, you were asked about the doctor, you said that doctor's name, and said, okay, that's fine.
No, I don't.
Would it refresh your recollection if I showed you a certified transcript? Would it refresh your recollection? Because, tell me why it wouldn't refresh your recollection.
I doubt it, because you could write anything, but it still wouldn't help me.
Okay. Tell me this, sir, just in your everyday life, and I know you were a father. Do you find that as a father and with your children, do their memories get better with time?
I don't know.
Would you agree that if I asked you what you had for breakfast 12 days ago, you might not be able to remember what you had for breakfast 12 days ago?
No.
But if I asked you today what you had for breakfast, you might be more able to answer that question.
Yeah,
And the first interview that you gave in this case was in February of 2019, is that right?
I don't know.
So you don't know the date of the interview that you gave with the police department? Do you know the date that you filed the lawsuit?
No.
Do you know the date that you had the call with Mount Carmel West?
No.
Do you know the name of the emergency room doctor that,
No.
that treated your wife?
Yeah, you gotta help me out here. Let her finish her question, then you can answer, okay? Okay.
No, you don't know the name of the emergency room doctor.
No.
Do you remember the name of the female nurse that you indicated that, was with your wife? That treated your wife?
I didn't know there was a nurse.
So you don't remember any nurses, that were with your wife when she was at Mount Carmel West?
No.
And is that true? No nurses either in the emergency room or in the ICU?
I said I don't remember any nurse there, period.
And just so I'm clear, so the jury knows, do you mean that you don't even, if you were to close your eyes, you can't even visualize any nurses caring for your wife?
I'm saying I don't remember seeing any nurses. I'm saying there was, I'm not saying there wasn't. I'm saying I don't remember seeing nurses. The only one I went in there was a doctor.
And when you say the only one that you remember was a doctor, was that on the ER?
Yes, in the ER, correct.
And then did you see any doctors when you were on the ICU floor?
The only doctor I saw was Dr. Husel, because when I never went into see my wife when she was in ICU. I never went into my wife's room, period.
Okay. So, and I wanted to ask you some questions about that. It's your testimony today that, tell me if I'm wrong, the last time you saw your wife was on the first floor of the hospital, is that right?
Correct,
You never saw your wife in the ICU.
correct.
And when you had this conversation with Dr. Husel, do you remember in February of 2019 telling the police that no one else was there when you had the conversation with Dr. Husel? Remember that?
No,
And so, you didn't say that, or no, you don't remember saying that?
I don't remember saying that.
And can I assume that your same response about refreshing recollection is true? It's nothing but refreshing recollection.
She wants to know, is there anything that you could look at to refresh your memory?
No,
And then you indicated that you had this conversation with Dr. Husel, and I can presume from your testimony a few minutes ago that no nurses, you don't remember any nurses around for that conversation either. Is that right?
I don't remember seeing no nurses, period. Thank you.
When was the first time you were provided with Dr. Husel's name?
I don't know.
Was it when Mount Carmel called?
I don't know.
I know you used the word dead, brain dead, heart dead, mom's dead. You knew at the time that your wife was on an external pacemaker. Is that right?
Did I use it?
Did you know that? You knew that, right, sir? That when she was in the ER, she was put an external pacemaker on.
What she had on her, I don't know. I just know that they said she had a machine helping her heart. What it was called, I don't know.
And so did you know that she was maxed out on vasopressors?
Pardon?
She was maxed out on medication called vasopressors or
No,
levodopa.
I don't know.
But you know that visually she was on the ventilator, is that right?
It was being helped her, but he said that she was, her lungs were working on her own, but it was need help. And her heart was working to be, and it needed help, but it did need help.
And with respect to the heart, she had had a heart attack a month prior when she was in Tennessee, right?
Correct.
So then she had a history of heart issues, because she had a heart attack a month earlier.
That's the only one I know of.
And you knew that when she was in the ER, and she was on the ventilator. I remember in your deposition, you talked about how she had been on a ventilator previous in her life. Do you remember that?
Yes, I do believe.
And when she was on a ventilator, was that at Mount Carmel West?
I believe.
And previously, when she was on a ventilator at Mount Carmel West, was she there overnight?
I won't say yes and I won't say no.
Okay, it could have been.
It could have.
And I asked the question, and so, do you know when she was on the ventilator previously at Mount Carmel West?
No.
But we know at some point that she came off of the ventilator from that prior time, right?
Oh, yes.
And do you have any knowledge or indication if Dr. Husel was working when she was previously on that ventilator at Mount Carmel West?
No.
And I know I had asked you about her heart conditions before arriving at Mount Carmel West on September 30th. But as her husband, I'm assuming you know that she had had 4 different hospitalizations in the last 3 months before her final time at Mount Carmel West, right?
I'm not sure.
Were you told, or do you know, sir, that when she was on the ventilator on September 30th, 2018, that she was at 100% oxygen support on the vent?
I don't know.
Did you know, sir, at the time that despite the ventilator, the vasopressors, and the external pacemaker, that her blood pressure was still 64/12?
I don't know.
But you did that night, sir, make the decision based on your wife's wishes that there be the ventilator be withdrawn, correct?
Yes.
And as you've expressed in your Columbus Police Department interview and in your deposition, she, your wife, had made it clear that she did not want to be on a ventilator, correct?
Yes, if she's going to be lived like a vegetable. No, she doesn't want to live like that.
And when you made the decision, and I think you said pull the plug, you knew, sir, that meant that all those life-saving measures, the ventilator, the pacemaker, the vasopressors, those would be turned off.
Yes.
You knew that.
Yes.
After you made the decision, I know you talked about going for a walk. Fair to say, sir, that that walk of yours was a very emotional experience within the hospital for you.
Oh, yeah.
And you left, and then, to your knowledge, Caleb and his girlfriend and her parents stayed behind.
Yes.
Is that right?
Yes.
I remember you being asked about whether you thought Dr. Husel was kind at the time. I'm not asking you how you feel now about Dr. Husel, sir, but during your deposition, do you remember being asked what you thought about his demeanor at the time? Do you remember being asked that?
Yes.
And do you remember what you said, sir?
At the time. I thought he was okay at the time. I think that's what I said or something like that.
I understand, sir. And I understand now that you have litigation pending, correct?
Yes.
And I assume, sir, that when a doctor tells you something, at least initially, You believe it, right?
If you tell me the truth, yes.
And is the same true, sir, when Mount Carmel calls you, that you believe that?
I believe it.
Yes. And is the same true, sir, when Mount Carmel calls you and tells you their version of events? You believe that too?
Yes.
Nothing more.
Redirect. You think you need more than a couple minutes?
What?
You think you need more than a couple minutes? I saw you look at the clock.
No, I'm not gonna be moving.
Okay.
Do you remember what you had for breakfast 12 days ago?
No.
Do you remember when you were told your wife was brain dead?
Yes.
That sticks out in your mind?
Something like that would, yes.
Why did Laura leave?
She had children to take care of. She thought because my wife was going to be okay, so she had other two kids to take care of them.
And that was after you guys talked to the ER doctor?
Yes.
It was your wife's wishes not to be on a ventilator? Remember that question?
Yes, after she was soon dead.
What was that?
If she was brain dead, she didn't want to be on life support.
And that's why you said what you said?
Yes.
Nothing.
We're gonna go ahead and take lunch, ladies and gentlemen. Let's come back at 1. We're gonna try to get through some more witnesses this afternoon. Remember the admonition, is an hour long enough for y'all? You okay? Okay. Just hang tight for a minute.
All rise.
We're gonna get them out the door and then I'll get you out the door. Have a great lunch, guys. I'm the only one who doesn't have to stand, but that's okay. I usually do. Okay, sir, you can go on out. Do we have the doctor?
Yeah, I'm near you.
Let's bring him in.
You're all done. I don't know if you're gonna stick around for Tara. You're gonna wait for her? So-
I'm the driver for it.
Yeah, okay. You want Dr. Roth at this point?
Yes.
Yes.
Is he back there? Where did he go? Relax, everybody. I'm sorry. My fault. Come Come on up to the stand, doctor.
Mr. Gobble and Mr.
Have a seat. You're still under oath. You understand that?
I do.
Okay. Any objection to going forward with that statement? Or do you want me to re-swear him? Okay. You got another document for us, I understand.
I do, Your Honor.
Okay. Now, if I remember correctly, you testified that he was the only doctor that used fentanyl for these types of procedures.
He was the only doctor that had ordered doses in excess of 500 micrograms, not on a ventilator, over that 5-year period.
Okay. So you testify, I wouldn't let the document in then. Okay? We're here today. Somebody asked you to do the document?
Yes,
Who was that?
the state.
The state did? And did they say why they wanted it?
I don't directly know.
Okay. Does it tell us anything more than you've already testified to?
Back to your original question, it doesn't rely on any peer-reviewed or privileged material any longer.
Okay.
But the outcome is the same.
Well, it's the guy who won't accept his balding front again.
Anything of them?
Yes. The state asked you through a subpoena, correct?
That's correct.
So a subpoena issued under the authority of Judge Holbrook by way of the state, Ducis Tecum, for the previous material that was requested by the defense in 2020.
Correct.
All right. And the only difference between what we asked for after the judge excluded this report and what Ms. Menashe asked for in December of 2020, or excuse me, I don't know, but in 2020, was that in this body of the subpoena, it was stipulated, Ducis Tecum, that this could not, the compilation of such data could not use any confidential and privileged information, correct?
That's correct.
And were you able to, pursuant to that subpoena, use a process or system that resulted in a report, in a report?
Yes,
And
correct.
when was that report provided to the parties in this case, if you know?
It was toward the end of last week.
All right. And I'm just going to show you what I marked for identification purposes as, well, before we get into this, how did you reach the conclusions in this report?
So the way the report is, we queried our systems to look for all doses in excess of 500 micrograms of fentanyl. And then you review the medical records of those identified to differentiate people who are on a ventilator primarily versus those who are not on a ventilator, because you cannot run a query that specifically calls that out.
All right. And who was involved in that process of examining the medical records and under whose direction?
It was under my direction, and it was myself and one other person, our chief medical officer.
All right. And the report that you produced on Friday, to your knowledge, is that fair and accurate reflection of what is requested in that subpoena?
It is.
So the actual records were reviewed by you and another person under your direction?
Correct.
What was the name of the other doctor that reviewed it with you? You said it was one of your chief medical.
Yeah, her name is Tammy Lundstrom.
Is she a doctor?
She is.
Munch. Go ahead. Spell it for her.
Lundstrom.
May I approach the witness, Your Honor?
You may. Jose is on.
So this is the original one produced
Mr. Baez, sorry.
to you guys. This is the one that was produced a second time, which is just this with the label on it. This is the So I'm going to show you what I marked for identification purposes. It states Exhibit 34A. 34B, and 34C. You said that there was a report that was initially under your direction, which did use confidential information as part of the compilation of that report, showing you what I marked for identification purposes as 34A.
Okay.
Does that appear to be that report?
It appears to be a report that was done, using privileged material.
All right. And that was what was shown, or that was what was the subject of your original testimony. And for the record, Judge, 34A is what the court said, because it was used, compiled using privileged information, could not be admitted into evidence. At some point, was 34A given a label which reflected what was contained in this report?
It was.
All right, showing you 34B, is that same report with now a title on the top?
It is.
Okay, and for the record, Judge, the title that was added after 34A was provided to both the parties 2 years ago, the title that was added last year was all instances in which patients within any Mount Carmel health system receive a dose of fentanyl at or above 500 micrograms while not in an operating room setting or on a ventilator. And then in parentheses, September 2013 to June of 2020. Is that what that label says?
That is what that label says.
And does that accurately reflect what this information is?
It does.
And just so we're very clear, in the entire Mount Carmel hospital system, that's the 4 hospitals, who's the only doctor doing that?
No, Dr. Husel.
So these were excluded because you used the peer-reviewed material that was, all right. And was the subpoena that you received?
Yes, that's correct.
And did the subpoena that you received, Duchess Tecum, after these were excluded a number of weeks ago, request this same information that's in this title of 34B with the addition that cannot be compiled using any privileged or confidential material?
That's correct.
Showing you what I marked for 34C, that's 34C. What is that?
That is the report that we created using the same guidelines, but starting from scratch, not using privileged material.
All right. And are there any other patient names on 34C that are different from 34A and 34B?
There are not.
All right. And are there any other doctors in the entire Mount Carmel healthcare system between 2013 and 2020 prescribing fentanyl 500 or above outside of the OR and while not on a ventilator?
There are not.
Thank you. And were the procedures you used based on your training and experience a reliable process that resulted in that said report?
They are.
Thank you. I have nothing else.
Mr. Myers?
Mayor,
Yeah.
Dr. Ross, this is a list, right?
It is a list.
It's a list of names, and I'm referring to States Exhibit 34C, 34B, and 34A, correct?
Correct.
It's not a report, correct?
It is a report, in my definition of a report.
Okay, well, let's talk about your definition of a report. The query that Mr. Zion mentioned, typing into a computer and then generating a report of which someone who is given 500 micrograms of fentanyl outside of an OR and not on a ventilator, you cannot enter that and come up with this list of names, correct?
No, the report requires both an automated query of the system as well as medical record review.
Okay, so in other words, this, based on what was the questions asked of you, is not the direct result of a query into a computer, correct?
No, it requires a further medical record review to generate the report. That's right.
And
I'm sorry. It requires a further review of the medical records to generate a report.
so, in light of that, you had to take names off when originally entering something into a computer, correct?
The final report removes names for people that were on a ventilator. That's correct.
Okay. And the person who did, and the way you do that is by reviewing medical records.
That's correct.
And you are a hospital administrator,
Sure, yes.
but you just happen to also have a background in medicine, correct?
I'm a physician. Yeah.
So in light of that, when you said that your process was reliable, kind of giving yourself some props there, right?
Yeah, I'm a physician. I'm comfortable with medical records.
You're saying I didn't make any mistakes because, well, you're not saying I didn't make any mistakes, right?
If I knew of mistakes, they wouldn't be in the report.
Well, you would know you made a mistake, correct?
That's correct.
Okay, so no one went and checked your work, right?
No.
And no one went and checked Miss, what was her name?
Dr. Lundstrom.
Dr. Lundstrom. No one checked Dr. Lundstrom's work.
We check each other's work outside of the two of us. That's correct.
You went through all the records she went through,
Yes.
even
Well,
the ones that you took off.
no, we talked about them together.
Okay, and
Help me out, Doc. Let him finish his question.
Sorry.
Okay?
Yes, Your Honor.
And what's database? What's the name of the software that was used to generate the first list of names?
The name of the software.
Yes.
So we have an enterprise data warehouse that extracts the data from an electronic health record called Cerner.
Cerner. So, do you know when the last time the Cerner system was updated?
I do not off the top of my head.
Okay. Do you know how often it's updated?
Regularly, but I do not know.
And you can also testify as to the entries given on the Cerner system, correct?
Can you clarify?
You can't testify to the reliability of the entries put into the Cerner system, correct?
By the physicians, you
Correct.
mean?
Or nurses,
Or nurses? No, we rely on the medical records as they are.
okay? And these patients' names that came out in the first list, did you print those out?
Yeah, did we print them out? No, I never printed them out.
Okay, so you never printed them out and turned them over to the state of Ohio.
Correct.
And you never, of course, turned them over to anyone else, right?
No, correct.
And you never hired an independent company to go ahead and review these medical records to verify your work,
Correct.
or the work of Miss Lundstrom, was it?
Correct.
And in addition to that, you specifically excluded people outside of the OR, correct? Patients outside of the OR.
We excluded patients in the operating room. Is that what you meant?
No, my question is, based on Mr. Zion's question, you excluded patients outside of the OR, correct?
That were on the ventilator?
Well, that's my question to you is, did you exclude people outside of the OR?
Yes.
Okay. And in fact, you can be in the OR and not be on a ventilator, correct?
Correct.
So if a patient is given 500 or more micrograms of fentanyl and they're not on a ventilator in the OR, that would be ones that you didn't review.
Correct. They're outside of the request as we received it over the last few years. That's right.
Okay. So that's not part of the request. And therefore, you could never say, based on that query alone, that there weren't other doctors giving 500 micrograms of fentanyl for someone who was not on a ventilator, correct?
But was in the OR?
Correct.
In the operating room? Yeah, that would be correct with that change.
And there are, how many names came up initially in terms of the 500 micrograms?
How many individual patients?
Yes.
67.
Okay. And again, you said that you didn't print these out.
Correct.
So as you reviewed the medical records, there's more than one page on the screen, correct?
The medical records themselves?
Yes.
Yeah, no, there's many, many pages in the medical
There were
record.
many screens.
Correct.
at a time. I can have just a moment, Judge. I have no further questions, Judge.
So you didn't learn anything new?
The same names show up, that's correct.
Okay. Anything else?
No.
Okay, you can step down. Any more comments?
Your Honor, it's obviously relevant that Dr. Husel is the only one in the entire Mount Carmel healthcare system prescribing 500 micrograms above outside of the OR and off the ventilator. It was compiled in a reliable fashion. We have the witness here who is subject to cross-examination, should they wish to inquire about that in front of a jury. And the reason that we asked for the second report was because you excluded the first report, which, known to all the parties, right there on the form when it was given in March of 2020, that this was produced, it's confidential, subject to protective order, produced to the defense as well and at the defense's request, so you excluded that. So we just said, well, let's fix it. So that's why, and it is the same exact information. So it's not like they can say, oh, now we got all brand new information. They've had the same information for 2 years. There was a question of admissibility because of the way it was compiled. We fixed that. We would ask that Dr. Roth now be allowed to testify to the report and to that fact. So that's why we went through the trouble of subpoenaing the same thing they subpoenaed with the caveat, problem you had, and that was your ruling that, hey, you can't use it because of the confidential material that was used to compile it. They've now fixed it. We should be allowed to use it. Thank you.
Again, this never addresses the main issue here, and that is that the court ruled pre-trial, court ruled in the middle of trial, both of which is that we couldn't have access, is that this was based on privileged information. Now, the fact that they went back and attempted to fix something still doesn't relieve the prejudice to the defense that we were not on notice that we would be trying a case, having to deal with this type of evidence. In addition to that, there's no reliability factor. We can't go ahead and cross-examine the second doctor, and in addition to that, we don't have these records to verify or to challenge the accuracy of the work done by Dr. Roth and by Dr. Lundstrom. If this were going to be an issue at trial, we could have asked dozens of witnesses or numerous witnesses, I should say, about this document and bring it and actually discuss its reliability. This also brings up Dr. Roth as a new expert, because now he is actually reviewing records and making determinations, which actually we were not placed on notice that Dr. Roth would be called to testify as an expert witness in this case. He essentially is, and now he's generating reports, which is really a list of names. In addition to that, even their own final document says, confidential, subject to protective order, produced pursuant to terms in March 16, 2020. So, I don't know what to make of that either. So it's just one thing on top of another, on top of another, on top of another, which still doesn't get past the issue of we were not placed on notice that this was an issue that I could address at opening statements in cross-examining other potential doctors at Mount Carmel, other potential administrators at Mount Carmel, and they just decide to, again, ignore the orders, the previous orders issued by the court, and start generating evidence towards the end of trial. I can't even say it's the middle of the trial. towards the end of their case in chief and were significantly prejudiced by this and have no way to effectively cross-examine this doctor based on whatever he did. He could have literally gone back, turned on a computer screen, had some coffee, had a sandwich, called it a day and said, oh, yep, I reviewed this. I have no way of knowing that. And I have no records to be able to cross-examine him with. We've been doing this throughout this trial with witness after witness after witness by bringing up records to show certain things that are inaccurate based on their testimony. I can't do that with this witness or Dr. Lundstrom. And I couldn't have done it with other witnesses to discount the credibility of this particular witness, which essentially means we do not have the right to confront Dr. Roth in the admission of this evidence. What we do have then is we have this already issue lingering out there that we still have to address. And that's not enough for the state. They want to double down and ask this court to now throw in evidence that was developed later on and not disclosed to the defense. And I just don't understand how we are at this point and how we resolve this issue, other than, one, not admitting this, and two, of course, figuring out a way of dealing with not only the Dr. Roth issue, but this other phantom report that Dr. Swatter testified to as well.
Any response back?
I don't know how else to say the words that I've said over and over again. This isn't new. This is 2 years old. This was produced at their request. The same material was reviewed. The same processes were used, except in the new report, the court found it that they couldn't use the confidential material. So we just said, do it by hand, or how he described, without using the stuff that you previously moved. It's the same things that they've had for 2 years. This is not new. And we talked about it, has attached to our email. I mean, it's not only not new, like last summer, they provided to us a title to this. So it's not like it's new then. We said, hey guys, this report, Mount Carmel has now added a thing on to say, this is what this is. And then we emailed the defense and said, we want to use this. Let's talk about this document and how it's admissible. And we thought we had an agreement as to its admissibility, as long as Dr. Roth testified, which we said, fine, we'll bring Dr. Roth in to testify. And we have those emails that are attached to the record that were all done pre-trial. After the defense got it, after it was relabeled a year ago, and we had those email discussions ahead of time. This is not something brand new. This was to fix what the court said was a problem with its admissibility a couple of weeks ago, and it's the same information. It should absolutely come in, Judge. This is not a discovery violation. This is not nothing new. This is just us addressing an issue the court had an issue with. So that's all I can say. Thank you. I don't know how else to say those words. Thank you.
I would just add one last point, Judge, if I may. Just because something is not new doesn't make it admissible. If the state wanted to use this evidence and was so dead set when the court denied the admissibility of it pre-trial, they could have requested a continuance to have this report done a certain way. Again, we keep calling it a report. This list done a certain way, and then disclosed it based on the non-privileged information. Then we would know we had to deal with it. Then we would know in opening statements we had to deal with it. Then we would know with cross-examining witnesses that we had to deal with it, and so on and so forth. You can't just throw things out there and say, well, you knew all along. That's not the case. That's not the standard. Admissibility is the standard. It was found inadmissible pre-trial. They did nothing to try and cure it pre-trial. And we go through the entire trial. Oops, we made a mistake referencing privileged information, which, again, then you still have that issue whether it was a mistake or not. And then let's just triple down on it and bring it up again later and try and see if we can get a third bite of the apple. So again, the fact that it's not new has nothing to do with this. They had an opportunity to cure it. They never did. And they're waiting till the end of their case to try and cure it and get 3 bites of the apple. So for that reason, we said on that in our prior arguments.
Pre-trial ruled that certain documents were privileged, therefore not discoverable by anybody. We kept that in there. That's the order. It's been the basis of the problem here today. So I did not have that specific report at that time, but I said all the underlying stuff done for the medical mal was not discoverable. Okay, that's issue one. At trial, it ran into the problems where they used documents they weren't allowed to use. We all went through those arguments and you all followed my rule. We're here today. My problem is as follows. He testified about the very nature of that report during his testimony. To recall him with a cumulative document, I don't think you can do it at this time. Now, it doesn't mean you won't be subject to it on rebuttal, but for now, it's cumulative. It's a summary of what he already testified to. What's the value of it? And the points about this being generated recently, we don't have any way to audit it, those things. Reliability is an issue in the background they really can't cross on. So for this time, no, the report doesn't come in. So ruled. Okay? Anything else for the record, Mr. Zion?
What evidence rule are you citing when you say cumulative document, Judge? I just want to, so I understand.
403.
403.
Okay, a document comes and goes. He's already testified about these facts. He creates something after he testifies that basically verifies what he testified to. Isn't that not by itself a cumulative fact when they really can't cross on it because it occurred afterwards? They don't have any other information than here. I tried to make them available. Essentially, the presidential effect of the cumulative evidence outweighs the beneficial use. 403. Okay? Anything else?
Yes, Your Honor.
Yes.
One thing, and I bring it up only now because of the next witness. I'll wait. Just, Your Honor, cumulative, but with respect to testimony, I just want to raise that it's my understanding that the next witness that the state intends to call is an individual, Tara Schwartz. It is a second family member with respect to Bonnie Austin. As we all just heard, we heard from Ms. Austin's husband just now. The state has, as a matter of practice, called one family member or representative for each patient. I believe that Ms. Schwartz's testimony would be cumulative in nature, particularly given, Your Honor, that Mr. Austin just testified that he was the one that made the code change status. He didn't say those words, but he said, pull the plug, and then he walked away. I anticipate what the state's argument will be, Your Honor, that there is no limit. But I would just make this argument. It is the one patient that they are having two family members to. I have reviewed Ms. Schwartz's deposition. She did not give a Coma Police Department interview, and I would just note the cumulative objection in advance of her being called. Okay,
well, the problem becomes there is the witness that just testified, his memory was directed towards what occurred there at the end. And all the other questions you asked him, any other statements, he didn't remember. So if they've got adding additional stuff, I don't mind the witness being called. Okay, if they're going to say other statements said by other doctors or other things like that, I think it's perfectly relevant. Because he can only fill in the one thing. And I believe his testimony was after he talked to Dr. Husel, he took a long walk. So there may be facts that occurred then that could be brought up by this person. So I understand your objection. There is no definitive number on the number of witnesses to an issue, as long as they're not cumulative. So, okay, anything else?
Judge, we want to make sure the record is clear. There was no pre-trial order excluding that report. I think you said that.
I did say that.
Okay, just want to make sure that's clear. I've got appeals back
It
here.
was excluded because it included part of that peer review group.
So when they are accusing us of our third bite of the apple, we never addressed this report in any pre-trial motions. And then second, we would like to proffer these reports for the record. We'll mark them as state's courts exhibits. So the record does contain them. And then we would also, just so we're clear, then the testimony about what is contained in this report stands. It's not being stricken at this
It's
time.
not being stricken.
Thank you, Your Honor.
Okay, just for the record, it'll be, I think we're at 14 for court exhibit. Since we dealt with it directly, it'll be all three reports. Why don't your people copy them during the lunch hour? We'll label them as courts exhibit 14 for the record. And that way you don't lose your exhibits.
Thank you, Your Honor.
Okay? Anything else?
That's it.
Okay. Enjoy your lunch.
Was Caleb there?
No, not at the time.
So after you get to the ER, what happens?
We get there and Laura said that she wanted Caleb there.
Objection as to what Laura said.
Yeah, don't tell me anything that anyone was talking about. I just want to know kind of what you did next, what you observed next.
Can you say that again? I'm sorry.
So you got to the ER without telling me what anyone was talking about. What happened next? What did you do? What did you observe?
Laura said that she wanted.
Objection as to what Laura said.
Sorry.
What was your understanding of what you heard when you got to the emergency room?
That she wanted Caleb to be there and that she told me to text him and.
Objection, Your Honor, as to what she said.
Go ahead, I'll let you, I tried to fix it.
It's fine. At some point, did Caleb come to the hospital?
Yes.
All right. Where were you when Caleb got to the hospital?
I'm not sure if I went with my parents to get him or not, but I don't remember.
Okay. At some point, did you leave the ER? The ER part of the hospital?
Yes.
Did you leave that area?
Yeah.
Okay. Where did you go from there?
That I don't remember.
You don't remember what happened after you were in the ER?
Once we got Caleb there, they were taking Bonnie up to ICU.
Okay. What did you do then?
We all went up there and Laura ended up going home
Okay.
because they said that she was going to be.
Objection as to what they said.
So either way, you're upstairs in the ICU. Who all is up there in the ICU with you?
It was me, my mom, Caleb, Dave, my dad, and my sister.
And where were you all? Were you in a hospital room? Were you in a waiting area? Were you in the hallway? Where were you at?
We were in the waiting room.
And what do you remember happening after you get to the waiting room?
We get up there and Husel came out and said, can I say that? That,
Okay, you don't worry about it, that's my job,
I'm sorry.
okay?
He said that he wanted to talk to us about what was going on. And my mom was saying that.
Objection as to what her mom's saying.
Let's ask more questions, please.
All right. So first of all, how long were you in the waiting area before Dr. Husel came in?
I want to say about like 10 minutes, maybe 15.
So he came in and he said he wanted to talk to you all about what was going on.
Yeah.
Then what happened?
I'm trying to be careful with my words. I'm sorry.
Did you go into another room?
Yeah.
Okay. Tell me about that.
We went in there and Husel said that she was brain dead and that her lungs weren't working and her heart wasn't working and that she had something wrong with her kidneys to where she went to the hospital in Tennessee a couple months before that.
Okay. And then what happened after he told you all that these things were wrong with her?
We all had different reactions to it and just kind of sat there in shock.
Did you say anything to him?
I don't remember saying anything. I just was sitting there.
Did you hear anyone else ask any questions of him?
My mom was asking if there was any.
Objection as to
Your
what
Honor,
her mom was doing, not saying.
can we approach, Your Honor?
a reliability issue within the law. There are exceptions to that, and one of those is statements by a party opponent. So it's perfectly legitimate for the state of Ohio to listen to testimony about what Dr. Husel said. If you watch the objections, you saw that they didn't object to that, okay? What other people say, if it's offered to the truth of the matter asserted, it's inappropriate for them to say that. Now, they can testify about what their understanding is of something, okay, without saying what was exactly said, but they cannot sit there and say, well, she said this, and then he said this, and then she said that, okay? If they're offering for the truth of the matter asserted. Does that make sense? That's about 4 weeks of law school right there. And I try to do that just to assist you, because lots been going on here, and I want you to understand why what's going on. So hearsay is one of those objections. We're going to ask a new question, we're going to continue on, okay? Anything for the record?
No, Your Honor, thank you, appreciate it.
No?
No, thank you, Your Honor.
Okay, next question.
All right. So let's kind of start back a little bit. You're in a different room. You're talking to Dr. Husel. He's telling you about Bonnie's issues, her prognosis, right?
Yeah.
Without telling me what anybody said, did anyone ask follow-up questions? I'm not asking what they were, but did anyone ask any questions of the doctor?
Yes.
Okay. And how was his response? What did you observe about his response?
The response each time was just a flat out no. Each time, no explaining, just no.
Okay. And after that happened, what next?
Dave ended up leaving the room, and Caleb went to go get him, and I went with Caleb, and we were just looking for him, and we all at some point end up meeting back in the waiting room after all that.
All right. And what happens once you're in the waiting room?
Someone came out, and I'm not sure who it was, but we were asked if anybody wanted to go back in the room with her after they took her off everything, and I said that I would.
Okay. And after you agreed to go back there, what happened?
We went back there, and
When you say we,
me and my mom.
okay, so it's just
Tammy.
you and your mother.
Yeah.
All right. Sorry. Go ahead.
We went back there, and they had her door cracked a little bit so we could actually like hear them take her off everything. And I had a conversation with Husel about how I wouldn't be able to handle the job because the emotions behind it, and just I wouldn't be able to handle it.
So you're outside of the room at this time.
Yeah.
So you're having a conversation. Did he respond to any of the things that you said?
He just shrugged it off.
When you say shrugged it off,
Literally just shrugged it.
and after you were in the hallway, what happened next?
We went in her room, and I went to go say my goodbyes to her, and
Was she on the ventilator at this point?
no, she was off everything.
Okay.
And I told her that Caleb and Dave loved her and that we'd look after them. And anytime I would finish my sentence, she would kind of move her head towards me, which was weird because she was off everything and she was moving. And I could see her chest moving up and down.
And did you see her make any other movements?
She moved her mouth a couple of times.
Okay. What happened after you were in the room with her and you observed those things?
That happened about maybe 3 or 4 more times, and I ended up leaving the room and went back in the waiting room after that.
Now, you said she did it 3 or 4 more times.
Yeah.
Was it sporadic or
Objection, leading.
did you notice a pattern in the way that she was responding?
Yes.
What was that?
Anytime I would finish my sentence, like completely after, it wouldn't be in the middle, or while I was talking, she would do it after I finished what I was saying.
All right. You said you left the room after that?
Yeah.
And why is it that you left the room at that point?
My mom told me to get out of the room.
Okay. And then you said you went to the waiting room?
Yeah.
What happened once you were in the waiting room?
I went out there and talked to Caleb, and I said that she passed.
And did you tell anyone out there about what you had observed in the room
I told Caleb about it.
that day?
Yeah.
Did you tell Mr. Austin, David?
No.
Is there a reason you didn't tell him?
I don't want to say I was too scared to tell him, but he was already an emotional wreck, and I didn't want to cause anything.
So you didn't want to tell David because he was already upset, you said.
Yeah.
Why did you think that would be a problem to tell him that? So was this a memorable moment for you?
Yes.
Why was that?
Because I didn't expect that to happen at all. I wasn't expecting it. I thought it would be a just peaceful and nothing moving, nothing like that. And it was completely the opposite.
Why did you think that?
Because she was taking off everything, and we were told she was brain dead.
Nothing further.
Good afternoon, Diane Menashe, on behalf of Dr. William Husel. I want to go through all the people you've talked to about this case, okay?
Okay.
Did Mr. Austin drive you here today?
Yes.
And you're still dating Caleb?
Yes.
And Caleb lives still with Mr. Austin?
We live together on our own.
Oh, you and Caleb do now?
Yeah.
And how long have you been dating Caleb?
In April, it'll be about 5 years.
So then you started dating in, what year is that?
2017.
So just want to go back to the people that you've talked to about this case. I'm assuming, since this was Caleb's grandmother, fair to say this is something that you and Caleb talked about?
Yes.
And obviously you were deposed in this case as well as a witness, is that correct?
Yes.
And when you took your deposition, you realized that you were under oath?
Yes.
And you're under oath here today, right?
Yes.
And have you also, how many times have you met with the prosecutors in this case?
One time.
And how long did that meeting last?
I want to say about 20 minutes.
And then is that separate and apart from any conversations you had in the hallway before your testimony?
Yes.
Yes, that was separate?
Yeah. Corinne came out and told me to just tell the truth and stuff. But the only conversation I had at the prosecuting office was that one time.
Okay, and what date was that?
I'm not sure the date, but it was, I think, last week.
Okay, and then the counsel for the attorney for David Austin, have you had meetings with that attorney as well? Not asking you what was said, just have you met with his attorneys?
Yes, for my deposition.
Okay, assuming you prepared for your deposition, right?
Yes.
So I just want to go back through, because as I understood some of the things you said, let's talk about those. You talked about your relationship with Bonnie. You remember your deposition was in June of 2021?
Yes.
And June 2nd specifically. Do you remember that?
Yes.
When you were asked during your deposition, how well would you say you knew Bonnie? Your answer was it not? I didn't know a lot about her, but I knew her for about a year.
I didn't know a lot about her medical history.
Do you remember saying, I didn't know a lot about her, but I knew her for about a year?
Yes, that was about her medical history and stuff I didn't know a lot about.
So then when you talked about the kidney in Tennessee, you didn't actually know that that was a heart attack that she had in Tennessee a month before her hospitalization?
I did not.
Did you know, in terms of your relationship with her, that in the 3 months before she was at Mount Carmel West the final time, she had gone to the hospital 4 times. Did you know that?
I knew she went a couple of times. I'm not sure for what or when, but I knew she had been in the ICU before.
And during this time in 2018, Caleb was living with his grandparents. Is that right?
Yes.
And did he ever live with his parents?
He lived with his mom, but I don't know timelines and stuff like that.
Fair to say his grandparents were taking care of him, right?
Yeah.
And so then let's go to the hospital. You were asked on direct about what you did and what you heard when you got to the emergency room. Do you remember that line of questioning?
I don't know.
Okay. Well, as I recall it, you indicated that you were told she was fine. Do you remember using that word fine?
Yes.
So let me go back to your deposition. Do you remember during the deposition when you said that that information was obtained by you from your grandfather?
From Caleb's grandfather?
From Caleb's grandfather?
Yeah.
Okay, because I want to be clear, you're not part of any discussions with any medical team or doctors or nurses, right?
Besides Husel, I didn't talk to anybody.
Okay, so let's focus on the emergency room. When you're in the emergency room, your testimony as to what Miss Austin's condition was or wasn't is only based on the information that Caleb's grandfather, Dave Austin, gave to you, right?
Yes.
Okay. So I want to be clear about where you believe you got that information. So then, because you aren't a biological relative of Miss Austin's, correct?
Correct.
And you were clearly not there as a next of kin,
No.
nor as a durable power of attorney?
No.
And how old are you?
I am 20.
And so at the time you were 16?
Yes.
And did anyone at the hospital ask your age at the time?
No.
Did you go to the hospital with your parents at the time because you did not have a driver's license?
Yes.
So then let's go to the conversations that you indicate took place on the ICU. What floor was the ICU?
I'm not sure.
You don't remember?
No.
What floor was the ER?
I don't remember.
What was the doctor's name in the ER?
I don't remember.
What was the nurse in the ER that was attending to Miss Austin?
I don't remember.
What was the name of the nurse in the ICU that was attending to Miss Austin?
I don't remember.
And in fact, when you were questioned in June of 2021 and you were asked the name of doctors or nurses, you said you don't remember, correct?
Correct.
So then you're in the waiting room on the ICU, moving up to the ICU, correct?
The emergency room, the ICU? Yes.
What day of the week was it?
I don't remember.
And you indicate that Dr. Husel approached to have a conversation with the family, is that right?
Yes.
He didn't approach you though, right?
No, all of us.
And tell the jurors, how big is the waiting room?
I want to say the waiting room was maybe about as big as this area, the open space. I'm not sure exactly. I know it was a really big open space and nobody was in there but us.
Okay, but it's a big open space, is it not?
It is.
And there's an elevator that opens into the waiting area?
I think so. I don't remember exactly.
And so at some point you indicated that you went into a room, like a room that offered some privacy.
Yes.
And everyone went along, or who went along?
It was Dave, my mom, Caleb, and me that went in that room.
And so if it was Dave's recollection that no one was there but him, would that be inaccurate?
Would it be inaccurate?
I don't believe that was stated.
Sure. And I know you were asked about this in the position.
Yes.
Who was and who wasn't present for the conversation. Because you remember, I'm sure you can imagine that who's present for a conversation in this case is very important,
Yes.
right? And assuming, well, let me ask you this. Even at 20, fair to say that two people can perceive the same event, but think of it differently?
Can you rephrase
Sure.
the?
Just a common sense question here. Two people could see one event, and wouldn't you have to agree that they could perceive that event differently?
I don't know.
So it's your testimony that you were in the room and overhearing the conversation with Dr. Husel, is that right?
When we were all in the private room? Yes.
And you don't remember if a nurse was in there?
There was no other nurses or workers in there.
And I noticed that you didn't mention the chaplain, Lisa, that was downstairs with the family in the ER.
I don't remember the chaplain. I knew there was one for the ICU. I remember her coming out and talking to us, but I don't remember exactly what was said or when.
And so when you say her, are you talking about Carrie Miller, or you don't remember her name either?
I don't remember her name.
But there was a chaplain on the emergency room floor?
The only one I remember was in the ICU.
I'm sorry, on the ICU?
Yeah.
And she spent time with the family?
Yes.
She spent time with Dave?
Yes.
Because there was some concerns, were there not, about Dave and the way that he was acting in the hospital?
He was very upset after hearing everything and was.
So let me just sorry, my question wasn't clear. Dave was acting.
Was acting?
Was behaving in a way that caused you and others in the hospital concern, yes or no?
Yes.
He was banging his head on walls, correct?
Yes.
There was great concerns about him potentially owning guns and what he might do with it. Do you remember that?
Yes.
So fair to say, and I ask this for no other reason than this whole event seemed to you, did it not, to be a very traumatic experience for Mr. Austin?
Yes.
And that traumatic experience began in the ER, right? When she was taken there, she being Miss Austin, and she was put on that ventilator, and then she was moved to ICU, right?
He wasn't affected by it until after we heard news that she was brain dead. He wasn't like that in the ER.
And I know you keep saying brain dead, but that's why I asked you about how many times you've met with people. I'm just curious. This event took place in 2018, right?
Yes.
The first time you ever gave a statement about it was more than 3 years later in 2021, right?
I wrote a letter for like memory because I figured that I would forget, and I did forget about the letter until it was given to me.
And did you provide that letter to the prosecutor's office?
I gave it to Dave when I wrote it, and I don't know who he gave it to.
And when did you give that letter to Dave?
I want to say a couple months after it happened. After we found out about it on the news, I wrote stuff out of what I saw.
And have you seen that letter since you gave it to Dave?
Yes.
You have. Who has that letter?
The prosecuting office.
We need to approach it.
It's right there.
Okay.
sorry, what?
You had enough time to review the document?
Yes, Your Honor, thank you.
Are you ready then?
Placed on the record,
Okay.
Judge, that it was actually already provided in discovery.
We got that over here, I thought.
No, she said they didn't have the letter in discovery. They did receive the letter in discovery itself. When was that? And on November 21st of 2019. Just so the record is clear that they had both the summary and on November 21st of 2019, the letter itself.
Okay.
Thank you.
All rise. Let's bring in the witness.
Thank you. Please be seated.
Thank you, ladies and gentlemen. Let's bring the young lady back up. And make yourself comfortable. Remember you're under oath. Let's keep your voice up, okay? Ms. Menashe.
Thank you. Go back to your deposition on June 2nd of 2021. Do you remember, and again, I just want to be clear, you knew, Tara, that during your deposition, you were under oath, right?
Yes.
And that's different from just having a conversation on the street. Would you agree with me?
Yes.
You understand that you're under oath, you have a legal obligation to tell the truth, right?
Yes.
Just want to make sure, do you remember being asked during your deposition on June 2nd of 2021, did you keep any notes or maintain a diary or anything like that about the events of September 30th, 2018 at the Mount Carmel ICU? Do you remember being asked that question?
Yes.
And do you remember that your answer was no?
Yes, I forgot about the note.
And this is when you were under oath?
Yes.
The note is the note that you've talked about. I just want to make sure you indicated that you've had a chance to review it before your testimony today. Is that right?
Yes.
When was the last time you reviewed it?
I want to say last week.
So tell me, how does it get to Dave? And then didn't Dave give it to his lawyer?
I don't know who he gave it to.
So how did it get back to you?
I went to the prosecuting office and they gave me a copy.
And then you reviewed it.
Yes.
Now, you understand that what you write is not under oath, right?
Yes.
Okay. And you would agree with me that this note that you're referencing isn't dated, right?
Yes.
I'm sorry?
Yes.
It is not.
It's not dated.
And you also understand that the litigation, that being the civil suit that was filed against Mount Carmel and Dr. Husel was filed in advance of that letter being given over to any attorney, right?
I'm not sure. What was the question?
Well, are you aware that the litigation, that is the lawsuit that Mr. Austin filed in this case, was on January 15th, 2019? You aware of that?
No. I wasn't sure when he filed for it.
Okay, so you just know that litigation has been filed.
Yes.
Okay. And I ask you this because you would agree with me that since you are not a family member, the attorneys representing Mr. Austin are not your attorneys, right?
Right.
Okay, so fair to say then you understand that conversations you have with those attorneys are not privileged, right?
Correct.
So I'm wondering if you know that in the lawsuit that was filed in January of 2019, it includes the allegation, about the brain dead language. Do you know that?
Yes.
You were told that?
Was I told
Yeah.
that?
Her question was, do you realize what was in that, the brain dead concept is found in that document?
Yes.
Okay? And she asked you, how do you know that? Essentially. Sorry to frame your question differently, but
I'm sorry.
So I'll slow down. So we're sure we get the right answer. There was a lawsuit filed in June 2019. Okay? Or I'm sorry, January. My correction, January. So the first month in 2019. And your testimony just now was that you are aware that within the lawsuit, specifically on paragraph 20 and paragraph 50, that there is this allegation that these words brain dead were used. Are you aware of that?
Yes.
And I assume, Tara, that you're close to this family, right?
Yes.
Caleb is someone that you've been with now for many, many years, right?
Yes.
And I presume, and it's relevant just because of the testimony that you've given, that you want them to win their lawsuit.
I mean, yeah.
So, just one other thing I wanted to talk to you, actually a few more questions. When someone says to you the words anoxic brain injury, and I know you're not a medical doctor, tell me what that means to you.
I don't know.
Okay? So, if you heard someone say she has an anoxic brain injury, how, if at all, would you interpret that as you being a layperson without medical training?
I wouldn't know specifically what that means.
But you would have heard the words brain and injury, we could presume, right?
Yes.
And with respect to this conversation with Dr. Husel, as you were asking your deposition, and it's your testimony today, that David Austin made the decision to have his wife, right, palliatively extubated because she did not want to be on the ventilator. Is that correct?
Yes.
I want to make sure for the jury where that decision was made. And when I say where, I mean physically. Because when you were asked in the deposition, isn't it true that you said that Mr. Austin was physically in Bonnie's room when he made that decision?
He was outside of his room, or her room.
One moment, wrong transcript. I know, it's wrong. One moment, Your Honor. Oh, here. Just, and are you aware that Dave just testified, Dave Austin?
Yes.
Were you in here when he testified?
No.
Just want to go back to your deposition. You said, did you not, Dave ended up going back to see Bonnie, and Dave decided to take her off life support or everything that she was on. Do you remember you saying that in your deposition?
I don't remember exactly, like word for word.
Okay, would it refresh your recollection?
Yeah.
To look at your transcript if I may approach her?
what are you showing her?
I'm showing her deposition transcript from June 2nd of 2021.
Marked as?
Well, I'm just doing it to refresh. Do you want to mark it? Court Exhibit 15.
Okay.
This section right here. And you know what? I'm going to ask you those questions if you want to just review those.
Yeah.
Now that you've had an opportunity to review that sworn deposition testimony, fair to say that you indicated Dave ended up going back to see Barney, and Dave decided to take her off life support or everything that she was on. Do you remember giving that information in your sworn deposition?
Yes.
And then you were asked by counsel during the deposition, were you not, did Mr. Austin make that decision in the actual ICU? You know, bedside. What did you say?
I said that he made the decision towards the foot of her bed. He was like in between the doorway and her room. So like just
Well, so Tara, let me just be clear though about what you said in the deposition. You said yes, did you not? Yes,
Yes.
he's at bedside.
yes.
So Dave Austin is at bedside of Bonnie Austin in the ICU when he makes the decision according to your testimony, right?
Towards the foot of his bed or her bed, just in between. It's hard to explain. I'm sorry.
Well, I just want to be clear though, that it said, did you overhear this? And you indicated, did you not? Yeah, right?
Yes.
And then you go on to explain, do you not? He was at the foot of her bed and he was saying, you know, if there's nothing that can be done, he was like, pull the plug. And then he ended up walking out. Do you remember saying that?
Yes.
These are all conversations that happened at the ICU with Mr. Austin in the room with his wife, correct?
Yes. But in
Okay.
between the room, like right in the doorway and towards the foot of her bed.
Well, Tara, let me, you use bedside in your deposition, right? Okay. And here's what I just want to be clear about. I know you can't tell me what Mr. Austin could see or couldn't see, but you would agree with me that when he was having the conversation and he said, on his own, pull the plug, he wasn't blindfolded, right?
Right.
He didn't have his back to the situation, right?
Right.
There was family there, right?
Right.
There was a male nurse there.
That I'm not sure.
You're not sure if there's a male nurse there.
No.
And then Miss Austin was right there in the bed.
Yes.
And this was on the ICU.
Yes.
And in fact, you not only don't remember whether the nurse was there, but you don't remember whether Dr. Husel was in the room when Dave said, pull the plug.
Right.
So that wasn't then. What we learned from that is the decision to say the words, pull the plug, had nothing to do with Dr. Husel being anywhere near him, because you don't even know if Dr. Husel was in the room.
Right.
Nothing further.
Redirect?
Yeah, we approach.
Sure. That coffee smelled real good this morning, ladies and gentlemen of the jury. I don't know what it is, but it should be outlawed. I'm on fire this morning. It was just like. you sorry about? You've been dancing with that machine for years.
All right, now Tara, we, on cross, you were asked about this note letter that you wrote. Why did you write it?
I wrote it for memory, and I saw the stuff on the news come out about it, and I figured that I should just write down what I know in case that anybody wanted to know what I saw.
All right. And what was your purpose of giving it to David?
I knew that if anybody was going to talk, they were going to talk to him, and I was saying if they want to see it or if they want my phone number, my contact, like you just give them this, and they can read over it.
And had you spoken to any attorneys before writing that?
No.
Do you recall when you wrote the letter, around the time that you wrote it?
Not exactly, but I know after like stuff came out about it is when I wrote it.
Do you have a year or a month that you remember writing it?
Objection, Your Honor, asked and answered.
I'll permit it.
I want to say late 2018 or early 2019.
You were asked about the phrase bedside. Do you know why that phrase was used in your deposition?
Objection, Your Honor, call for speculation.
Well, I believe she's the one who used it.
Yeah, do you know
Why
why?
don't you rephrase the question?
Do you know why you used the phrase bedside in your deposition?
I was just explaining like he was beside her bed.
Was it your priority on September 30th, 2018 to learn every person's name that you met?
No.
What was your priority that day?
Objection, Your Honor, beyond the scope.
I'll permit it.
Just to get Bonnie back home and better.
Nothing further.
Yeah, give me a step down, ma'am.
Actually, Your Honor, I'd like a follow-up question with respect to the date,
To the date of what?
the news coverage.
I mean, the date, well, the only date that she discussed on cross was the date of the document.
That she wrote it after the news coverage.
I'll give you one on the news coverage. Go ahead.
Herr, would it surprise you to know that the first news coverage was on January 15th, 2019, when Mr. Austin filed the lawsuit?
Will you repeat the question? I'm sorry.
Would it surprise you to know that the first news media about Dr. Husel's potential involvement here was on January 15th, 2019, the same day that Dave Austin filed his lawsuit?
No.
Nothing further.
Okay, ma'am, you may step down. Call your next witness.
Thank you, Your Honor. The state of Ohio calls James Allen.
All right, guys, I'm back for the rest of the afternoon now. Let me guess, this is like a doctor of dildoology. Talk about fentanyl use.
You swear or affirm to tell the whole truth and nothing but the truth, so help you God? I do. Thank you. Please take a few seconds to be seated and make yourself comfortable. All right. And if you would be so kind as to state your name for the record and spell your name, please.
My name is James David Allen, JamesDallen.
Thank you, Jim.
Okay, you guys hear him okay, I assume? Okay. Ms. Scruggs.
Finally. Jim, I'm going to show a picture here.
Yes.
Could you let me know who is shown here in State's Exhibit 8A?
That's James G. Allen. That's my father.
Okay, thank you. And is your dad one of the alleged victims in this trial?
Yes.
Was that his driver's license picture?
I believe so. His ID.
Jim, are you a Central Ohio resident?
Yes, ma'am.
Are you a married guy?
Yes.
Do you have kids?
Yes.
Grandkids?
Yes.
Okay. Jim, who was your mother?
My mother was Donna Fitch.
And was your mom your dad's first wife?
Yes, ma'am.
Okay. And do you have other full siblings?
No.
What about half siblings?
Yes.
And what are their names?
I have a brother John and a sister Lisa from my father. And
Okay. And what is their mother's name?
Barbara Allen.
Now, your mom passed, is that correct?
Yes, ma'am.
Is Barbara still alive?
Yes.
Are you employed, Jim?
Yes, ma'am.
Have you been following this case?
Yes, ma'am.
Did a family member secure legal counsel arising from your dad's death at Mount Carmel West?
Yes, ma'am.
Is your stepmother the
I'm not good with dates.
That's okay. Do you remember the period leading up to your dad's death?
You mean like when he first went to the hospital, or?
No, just the time leading up to when he went to the hospital.
Well, he was, my brother John was their caretaker. We had made arrangements. Probably 10 years ago, my stepmother Barbara had a stroke and she's bedridden. Sorry. And my dad, shortly after, was taken in, and he was diagnosed with heart failure.
Now, how many years before he passed was this?
My father? About 10 years.
Okay. So, how would you characterize your dad's health leading up to his last hospitalization?
He was still as ornery as ever. I mean, he had heart disease, and a lot of these diseases that are coming out in his records, he's had those, most of them for 10 years, except for the sepsis, the gallbladder. He had a lot of those for all those years, and like I said, he was still ornery as ever.
What did your dad's usual activity level consist of?
Well, I mean, he was 80, and I know he liked to paint, and he liked to do paintings, and he liked his garden, well, a flower garden, and he always had a pond. Like, he would make a little pond in the backyard. We lived in the city, and he would just make a little pond, and he loved pets. He had pets, and he just loved doing stuff like that, being with his grandkids.
Okay,
Mostly.
So, but was your stepmother more limited than your dad?
As of like 2012, I believe, she was bedridden. But before that, she was very very much alive. You know, she was always out helping people and doing what she could. And she worked hard her whole life.
And did you enjoy a nice relationship with your stepmom?
Oh, yeah. Mm-hmm.
Okay. So let's turn your attention to your dad's last hospitalization and the time right before that. Who all was in your dad's household when your father was leading up to your father's hospitalization?
You like who lived there?
Yeah, who all was living there?
Up to that hospitalization, it was him and my stepmother, Barbara Allen, and my brother, John. He was taking care of her, and his girlfriend. He had a friend there to help him, you know,
Okay.
with things in the house.
Do you remember your dad's last hospitalization?
Do I remember it?
Yeah, do you remember it?
Yes, I
Okay.
remember.
What was
It's
your
not funny.
understanding about why he went to the hospital?
Well, at first, you know, we wasn't too sure, but on the 24th, we found out he was septus. His gallbladder was backed up.
Okay. And what month and year was this?
This was May the 24th, 2018. Like I said, I have to think, I'm not real good with dates and, you know.
Was this a week leading up to a holiday?
Oh yeah, this was Memorial Day weekend.
Okay.
Yeah.
Were you in town when he went to the hospital?
I was actually in town on the 24th, and I believe the 25th. We had went to the hospital that evening, and we left just before I think he was in recovery, and we left because it was pretty late at night, and I get up early for work. I get up at 4 in the morning, so.
Do you know what time he went to the hospital?
Not precisely, no.
Had you been to work that day?
Well, we were trying to think. I mean, this has been 4 years ago. I believe I was at work that day. There was a vacation somewhere in there, but I believe I had been at work that day.
Okay. Were you in town for the rest of the hospitalization?
No.
Where were you?
We went to Beauty, Kentucky. Where my dad was born. We had found our family, the Allen family cemetery up on the hillside, and we had went up there to investigate that so we could have it cleared off, because it was like a jungle. I mean, it was back in the woods, you know. So we went down there, and there's not a lot to do, but Johnny was keeping us in touch of his hospitalization. So we came back that Sunday, and the 27th, we came back. It was kind of late, so we just came home and went to bed.
Well, what did you do the next day?
The next day, when we got up, we went to the hospital, and I went back to see my father. He was back up in ICU. There were, when he first went in on the 24th, he was in ICU, and they done the gallbladder procedure to clear his gallbladder and some stones or something. I mean, I'm not a doctor, but that's what we were informed.
Okay, let me ask a couple other questions. Do you know, how do you know what time of day it was when you got there on the 28th?
On the 28th?
Mm-hmm.
Well, because I just woke up, and we had intentions of going to the hospital naturally to see him.
What meals had you eaten, or what meals did you eat?
Well, we just grabbed some breakfast, you know, when we got up.
Or did you have lunch that day?
I don't remember. I think it was like, it was someplace close, maybe Spaghetti Warehouse or something like that. We had some close friends of ours that can't come to be with us to console us through this. And They went to lunch with us, and I think it was Spaghetti Warehouse, maybe. I'm not sure about that.
So do you know what time you got to the hospital?
That morning, probably around 10.
Did you review your deposition in this matter?
Yeah, I went over it.
Do you feel it's clear from the deposition what time you arrived on the 28th?
Not on the deposition. I was, they go back and forth on their questionings. My brain don't work that way, you know, and they were asking back and forth. You know, they went, I think, you know, they were diverting me or whatever, but I answered some questions about the I believe it was the 28th, that I was answering about what I did on the 24th. I don't know if anybody understands, but my mind wasn't in track with them. You know, I was like still thinking about when he first got there, and I said, that's why I said in the evening, but they were talking about the 28th. When on the 28th, I got there in the morning. So there was confusion on my part, my mistake.
Okay. When you got to the hospital, what did you find when you arrived?
My dad he was back in ICU. He'd been released from ICU, cleared of his sepsis. He coded, and they had him back in ICU. So he was in ICU, he was incubated, and he was unconscious. He was just unconscious.
What were you surprised?
Oh, well, yeah. I mean, because he was pretty unconscious, you know, there was no movement. He was very unconscious. I asked the nurse that was there, why he was unconscious. You know, it might sound like a silly question. He was incubated, but he was very unconscious, and she said that it was he was, you know, he was being sedated, and I asked about the IV tree. It was just loaded. In my eyes, it was loaded with stuff, and I was asking about that, and it was vaguely answered. Of course, I'm not a doctor. I wouldn't really know, you know, totally what that was, but I know he was being medicated, and he was very much out of it. I mean, he was just gone. It was sad.
What was your understanding regarding the plan of treatment for your dad earlier in the week?
We were under the impression that he was waiting to have his gallbladder removed, and at that time, that's all he really was waiting on. Well, and then he had the code. So
I'm sorry, I'm
go ahead.
Trying to step on you. When you got to the hospital on the 28th, who was there?
I think Johnny was there. I believe my brother John. He was pretty animate about being there as much as he possibly could. That's his job. He takes it serious. We had made those arrangements 10 years earlier with him that he would stay there and be with them and care for them. So yeah, I'm sure Johnny was there.
Okay. Now, who did you first speak with as far as any medical personnel?
That the nurse that was there. I don't know her name. It was a young lady.
Okay. And do you know when you first spoke with any medical personnel?
I don't think I spoke with anyone until that evening.
Okay. And without quoting them, what was the impression you were left with after any conversation with them?
With who?
With medical personnel. The first medical person you talked to.
The first medical person? Well, I was just told that he was being sedated. And I was under the impression we were waiting for his gallbladder to be removed, and it was the Memorial Weekend, and so I figured we were waiting for Tuesday or something, you know?
Yeah.
because I had not spoken to a medic, like a doctor.
So what was your dad's condition to your visual inspection of him?
Well, he was out, but I mean, he still had color, and I mean, I wasn't too alarmed in that manner. I'm not thinking along that lines.
To your knowledge, did you or either of your siblings go to the nursing station to retrieve a nurse at any time?
No, I don't even know where the nursing station was, to be honest.
To your knowledge, did any of the grandkids retrieve a nurse?
Retrieve a nurse?
Go get a nurse.
No, not that I'm aware.
Are you aware that the medical records say that somebody went to the nursing station to retrieve a nurse?
Oh yeah, I've heard that.
Do you believe that's true?
I know that's not true.
Did your brother leave to go home at some point?
Yes, he left. My sister told him she would stay with him that night, and he went home to clean himself up and take care of our stepmother, their mother, my stepmother, Barbara. And he went home just to take care of business, and Lisa, my sister, was going to stay there with him. So yeah, he did. I don't know exactly what time it was.
Did you speak to a night shift nurse regarding your dad's condition?
Yes.
Who was that?
Jacob Deemer.
What kind of a conversation was it?
Well, it was kind of, what led into that was my niece and nephew, they came out to the waiting room, and they were very upset. And they said that the nurse in there told...
As to what they said?
You can't say what they told you. What did you do as a result of what they said?
Well, we went back to his room.
And then what did you find in there?
Jacob Deemer, Nurse Deemer, he was at the bedside, and he started, my sister and I went back out of the waiting room because, we was only 2 people back there in ICU. So we go back there in his room, and Jacob Deemer starts telling us that he's having a total organ failure.
As to what Jacob Deemer said?
Okay, what did you,
Sustain that, rephrase.
thank you. What was your understanding after having a conversation with Mr. Deemer?
That suddenly my dad was in total organ failure.
Did you ever have a conversation with William Husel?
Personally, he spoke to us as a family unit.
Okay, all right. When was that?
That was later on after Johnny had come back. My sister had called him as soon as we went back to see Jake Deemer, and so Johnny was on the way. And now when Johnny gets there, I just remember us ending up in the hallway, and then Mr. Husel come up the hall and from somewhere, and
Okay, stop right there. Who all was there?
We were in the hall. I think some of our kids were in his room with us. My wife, brother, and sister were more towards the hall, and Johnny was on the phone with his mother, Barbara.
Okay. And did anybody from the hospital ever talk to Barbara?
Yes, Mr. Husel took the phone from my brother and walked down the hallway talking to my stepmother, Barbara, about my dad's condition, I presume.
Okay. And when he came back from that conversation, what was your understanding about what Barbara wanted to have done?
That we were to make the decision on what we were to do about my father's health care as a family.
Okay. Now, were you advised by the doctor of your dad's condition?
Yes.
After that conversation, what was your understanding about your dad's condition?
Well, we were advised that he was in total organ failure, and that it sounded kind of crazy to us, but the life support meds were actually killing him. Okay, makes a lot of sense, but that's what was causing his organ failure, and that he had no chance. He wasn't going to recover. That they were just prolonging life.
Were you given any options about his care?
No.
Was a decision made to withdraw care from your dad?
Yes, based on the doctor's information.
Why did you all make the decision you did?
Well, we were told several times that they needed to do that if we didn't want him to be kept alive by life support. We asked, when was he suddenly on life support? We were just shocked that now he's on life support. We thought he was waiting on surgery, and now we're told he's on life support. When did this happen?
Okay. Now, when you talk about William Husel, is it the gentleman over my left shoulder in the courtroom? I'm sorry?
She just wanted to stipulate that he would identify the defendant.
Okay, thank you.
And as I explained to you, it's an agreement by the parties which take as true.
Thank you. Did you want to wait until the next day?
Well, we wanted to wait for his birthday. I mean, his birthday was on the 29th, and we had like 20 minutes or so till his birthday. And we asked several times about, well, it's his birthday. Can we wait till his birthday?
What were you told about that?
Well,
Objection, Your Honors, what he was told.
Rephrase, please.
What was your understanding about that?
That question was not answered. We wasn't given an option.
Okay. And was Dr. Husel part of that conversation?
Yes.
Did you ask Dr. Husel or anyone else how long your dad would be with you after this procedure?
Yes, in a manner of speaking.
What representations were made to you?
Well, we were told that
Objection as to what he was told.
we was told as a family unit.
Hold on. Hold on. It's what was told. That's different. Rephrase your question, please.
What was your understanding based upon that conversation of how much longer your dad would be with you?
Your Honor, I think it's just another way to call for hearsay. If it's specific to Dr. Husel, the court has explained. Other than Dr. Husel, it's hearsay.
Okay, I don't know what the answer is yet, so did you understand the question?
I understood the question. Yes.
Okay, can you answer it?
We were told that he would go quickly and he would not suffer.
Who
And
told
we were
you that?
the doctor.
Dr. Husel?
Yes.
Okay.
Thank you. Okay, did you,
Well, once I haven't finished up his answer.
are you done?
Well, we were told he would go quickly and he would not suffer. It was said, how do you know? And his reply was, experience. His experience told him that my dad, his experience told us that he would only live for a short time and he wouldn't suffer.
Did you ask what medications were being given And how much was being given?
Well, I asked when I first got there, and I was told it was, he was being mildly sedated, being
Jim,
sick.
I'm talking about it at the end of the.
Yeah, well, no, there was no discussion of what he was receiving.
Did you ask Dr. Husel directly about waiting for his birthday?
Yes.
And what was his response?
I don't recall that there was a response.
And what happened?
Well, we told him that if he had no chance of recovery, you know, and they were insistent on this, they just kept persistently telling us that he had no chance of recovery. They had to pull the vent tube. They had to get this done. You know.
Objection, Your Honor, it's not responsive at this point.
I think it is.
Thank you. Did you see any part of the procedure as far as the extubation?
Yes, they asked us to leave the room. It's not really a room. It's just, you know, it's like a hall, and then there's a curtain. So then our children come out of the room, and we were in the hall, and they kind of pulled the curtain. And as Mr. Hughes was talking still about how he was going to die quickly, and Jacob Deemer is already like disconnecting the IVs port, and I seen him with the syringe in the IV port. I mean, I don't know what that was. And then I seen him go over to the other side of the bed, and he ripped the port out of, or not the port, the breathing tube. He just ripped it out of his mouth and threw it away.
Was
And then
it just like that?
yes, and then he wiped his face. Okay, and then that was that. And we thought that was kind of odd.
Did you get to go back in the room?
Yes.
Were you with your dad?
Yes.
Were you able to call your own pastor before his death?
No.
Why not?
We was never asked.
And what time was this?
Oh, this was in the 10 or 11 o'clock time period.
Okay, how many hours
Probably
before your dad's birthday? Or how many minutes?
Minutes. Well, it was, I remember it was 20 minutes. It was 20 minutes till, so it had to be what, 11:40 or something.
Thank you, just a minute, Your Honor. Did you gather around his bedside and do anything as a family?
Yes, we gathered around the bedside, and we discussed that we would just go ahead and sing happy birthday to him. And then we sang Amazing Grace, and we held his hand, and we thought he was gone, and we heard someone say there's still a faint heartbeat. And then moments later, we heard that there was no more heartbeat. So he was gone.
Okay. Thank you, Jim.
Mm-hmm. Thank you.
Ms. Menashe will, I believe, have some questions for you.
Ms. Menashe?
Good afternoon. Diane Menashe on behalf of Dr. William Husel. I know you have a right under the law to be here, but I just want to make sure. You've been here throughout the entire trial, is that correct?
Not the entire trial.
How many days have you been here since the beginning?
Oh, maybe a half a dozen.
And when you're not in trial, you've been watching the trial?
Of course.
Okay. And so you've seen me do this questioning, if you will, of each of the family members of each patient, is that right?
Yes.
So you talked about all circling around, and you also talked about there was questions on your direct examination as to what your granddaughters and daughters, I think, were doing. I want to just list the individuals that were in the room that were able to encircle your father and be with him. Who was there? Let's go through name by name.
Name by name?
Yes, please.
All right. My two daughters,
Okay, and what were their names, sir?
Ashley and Amanda.
Amanda Tracy, I just want to make sure I have her last name correct.
Sure, yeah.
Okay, and who else was there?
Myself, my wife, my brother, my sister, my niece, nephew. There may have been some more. I don't recall. I wasn't taking count of who was there.
Okay, but your daughter Amanda was there, is that correct?
Yes, of
And
course.
And you were asking questions about what other people were doing,
Pardon?
you were asking questions on direct about your other family members, and I just want to know, would it surprise you to know that your daughter, Amanda Tracy, on May 29th,
Yeah.
who was in the room,
Yeah, of course.
Um,
It was her grandfather.
indicated that she thought Dr. Husel and her staff.
Hearsay.
So, let me ask you this. You were all there to witness this, right? You were all there to witness. the
Yeah, you
passing
asked
of
me
your
that. You
father's
already
life.
asked me that. Mhm.
Okay, hold on a second. Let her finish her question, and then you can answer,
Oh, I
okay?
thought she was finished. I'm sorry.
No, she kept talking. It's
Okay, I'm sorry.
Let her finish talking, and then if there's a problem, you can ask me, and I'll tell you yes or no.
Yeah.
Okay?
Yeah.
Ms. Menashe?
Is your family's litigation still pending, sir?
Yes.
Would it surprise you to know that not everyone in the room perceived the last moments of your father's
Object.
life?
Hearsay.
Okay, hold on. Finish up your question.
Would it surprise you to know that not everyone in the room perceived the passing of your father or Dr. Husel's comments in the same way that you did?
Object.
I can't answer for what other people think, or I can't answer for anybody else but myself.
No, she wants to know if you'd be surprised if other people. had
Would I be
different opinions.
surprised?
Yeah.
No.
You wouldn't be surprised.
No, I mean, everybody has their own thoughts and opinions, right?
So I want to go to some of those thoughts and opinions, if we could. You indicated in your direct that you seem to be shocked that your father was on the ventilator, but you know, surely, that your father coded and was on
I didn't say that.
So, and I know the judge.
I didn't say I was shocked about having my dad being on a ventilator. I did not say that.
So, here's sort of how the process works, sir. I know you see it, but
Okay.
I ask the question and then we'll.
Object, Your Honor.
Sustained. Sir, this is gonna take a while. Let her finish, ask her question, finish it. I'll say yes or no whether you can answer. Fair enough?
Okay, all right. I'm sorry again.
Okay.
I'm sorry.
I
Ms.
think
Nash.
it's relevant, Your Honor, for me to ask the following question. Sir, do you feel a certain way about me personally because I represent Dr. Williams?
Object, Your Honor.
Sustained.
Okay.
Let's go sidebar.
Let's go.
No, let's go sidebar.
Yes,
24th, you were not at the hospital, correct?
incorrect. I was there at the hospital.
You were at the hospital on May 24th,
Yes.
2018?
Yes.
You were there on the 25th, 2018?
No,
You weren't there on the 25th. Were you there on the 26th, 2018?
no, ma'am.
Were you there on the 27th of May of 2018?
No, ma'am.
So for 3 days, you weren't there at the hospital while your father was at Mount Carmel West prior to his passing, correct?
Correct.
And you indicated during your deposition, which was sworn under oath, right?
Which deposition?
Did you take more than one, sir?
Well, I was depositioned by Mount Carmel, Trinity East. I was depositioned by the Husel's attorney. So would that was two, right?
Well, it was all one sitting, was it not?
It was one sitting, yeah.
On October 28th of 2020.
But I was questioned separately.
Do you remember the date of the deposition, sir?
I think I already answered this, but it was, I think it was in October of 2020.
And during the deposition, you were asked, were you not, that from the 24th to the 27th, John, your brother, was your only source of information? And you answered, did you not? John and my sister, yes. I hadn't had an opportunity to talk to any doctors. Is that correct?
Yes.
Then let's go on. We'll just stick with your deposition testimony, which that was about a year and a half ago, sir. Would you agree with me in that?
Well, that was October 2020, so,
And it's March 2022.
yeah.
You indicated that when you first saw your father, he was in the ICU. So on the 28th, when you got there, he was in the ICU, correct?
Yes, ma'am.
He was on a ventilator, was he not?
Yes, ma'am.
Was it your understanding that he coded at 9 a.m. that day?
Yes, ma'am.
So all through that day, he was on the ventilator after he had coded at 9 a.m.
Yes, ma'am.
And when you arrived at the hospital, according to your testimony on direct, it was 10 a.m. Is that right?
Yes.
So you familiar just generally with work shifts, day shift, night shift, et cetera?
Of course, yeah.
So 10 a.m., you would agree with me, is commonly referred to as the day shift.
Yes.
So let's talk about things that happened on the day shift before the nighttime, before the night shift. Do you remember any spiritual care providers spending time with the family on the 28th, since you weren't there on the 25th, 26th, 27th?
No.
You don't?
No.
Have you, question, have you had an opportunity, you mentioned your review of the records. Did you review all the medical records of your father?
I've never seen his medical records.
You have? No one's
I never
provided?
said I reviewed his medical records.
Okay. I think you were asked about that note about whether anyone went to the nurse's station. Do you remember that?
Yes,
And you said you wouldn't have known where the nurse's station was.
correct.
But you didn't review medical records in this case.
No.
And it's your testimony, is it? You don't remember any spiritual care providers with the family at any time on the 28th?
Correct. No spiritual care from Mount Carmel.
Any religious person, you don't remember them at all?
Well, I'm not really a religious person, but I do have a relationship with my Lord and Savior, Jesus Christ. I'm sorry.
My question was, sir,
Huh?
a spiritual care provider or a chaplain or someone that was in a religious care providing role, you don't remember anyone from Mount Carmel in that role coming and talking to the family on the 20th?
Yes, I don't remember anybody. No.
Then want to go to other things that happened on the day shift. You got there at 10, Do you remember at about 1 p.m. when Dr. Adam Mahoney spoke to the family and explained to the family as a whole that there's really nothing that the hospital can do for your father? And Dr. Mahoney communicated that your father would not survive this episode.
I do not recall that. I never seen Dr. Mahoney.
You never saw Dr. Mahoney?
No.
And at this point in time, fair to say your brother was the main point of contact between medical staff and your family, right?
When he was contacted, I guess.
Well, was your brother there, if you know, the 24th, 25th, 26th, 27th, 28th?
I seen him there on the 24th and there on the 28th.
And
I
you
can't speak
testified
for
on
him.
direct, did you not, that he took his job as a healthcare provider for your father very seriously?
Yes, he does.
And we also know that you said in your deposition that all the information you got about your father's health was from John, right?
Yes. Well, my sister,
And your sister.
John and my sister.
Okay. So you don't know about the conversation with Dr. Mahoney?
No, ma'am.
Do you remember testifying, at least on your direct, that Dr. Husel, Dr. Husel grabbed the phone and had a conversation with your stepmother? Do you remember that testimony?
Yes.
Do you remember being asked about that situation during your deposition?
Which one? I mean, I don't remember, no.
And when you were asked if you knew a Dr. Weiss, does that name sound familiar to you?
Not to me personally.
And so it's your testimony here today that it was Dr. Husel and not actually the resident physician, Jessica Weiss, W-E-I-S-S, in internal medicine, that spoke on the phone with patient's wife, Barbara, regarding healthcare power of attorney and her rights as decision-making regarding her husband's care.
At what time?
5 p.m., sir.
I can't answer that.
Well, the question was, it's your testimony that it was Dr. Husel that did that and not Dr. Jessica.
That was at like 11 o'clock at night.
Oh, so it's your testimony now that the decision with respect to POA was made at 11 p.m.?
I didn't know it was any other time. I didn't know that I stated that it was at any other time. There may have been a phone call at 5, but I'm not aware of it. I'm aware of Husel taking the phone and going down the hall, talking to my stepmother, Barb Allen.
And I remember listening to your direct testimony about that call, that he took the phone to talk to your, took the phone, right? Do you remember that, sir?
Yes.
And it would be inconsistent that actually the one that spoke on the phone was Jessica Weiss. Is that true, sir?
I would guess.
So just so we're clear though, right?
Well, I mean, maybe Mr. Husel was talking to that doctor. I don't know. But I know my brother was talking to his mother, my stepmother, on the phone. And that she had supposedly told Mr. Husel that she wanted us to make the decisions, any medical decisions, on behalf of her for my father.
So I want to be really clear about this conversation, sir, because this conversation, whoever was on it, it's your testimony, is it not, that your stepmother was being asked about whether or not her rights could be relinquished to John Allen, right, or any of the children in terms of healthcare decisions. That's what that phone call was about, right?
I guess. I wasn't on the phone call.
Well, you testified on your direct that that's what the call was about, sir. So I'm just trying to make sure we're talking the same call.
Well, you was talking about two different calls just now. I don't know. I don't know that. I mean.
So then let me ask you this, sir. Do you think there was two calls? Just do you think? Do you think there was two calls to Barbara? And Barbara is your father's wife, right?
I have no idea. Yeah, she's my father's wife of 53 years.
You don't know if there was more than one call to Barbara about whether she would relinquish her rights to Mr. Allen and defer healthcare power of attorney to her children? You don't
I was
know.
never informed of that, no. I can't speak on behalf of
And
anybody.
you don't know Dr. Weiss, is that right?
I don't know.
And do you know Dr. Gandhi?
I've never met him. I never talked to him.
So then let's go, if we could, back to your deposition. Where? I'm just following up on your comment. I never talked to him. You were asked in your deposition with respect to your conversations, if any, with Dr. Husel.
Excuse me, Your Honor, could we please have a page?
66. Question, do you remember being asked a question, sir? Did you ever have any direct discussions with Dr. Husel? Your answer, not directly. Do you remember that answer?
Yes.
Then you went on, did you not, to say, I don't believe I directly had any conversation, a conversation with him. Remember saying that?
Yes.
And then you went on, did you not, in your sworn deposition in 2020, to say that all you recall is that he had my brother call his mom would be Barbara, right? To discuss with her about the care of my father and what she would do. Do you remember that? Answer, here, sir?
Yeah.
And then you went on to say, did you not? He prompted John to call and ask her, and next we're being told, she told him that she would like for us children to make the decision on what actions to take because she wasn't there and she couldn't make the decision. That was your testimony about what Dr. Husel did and the extent of that conversation that you just testified about in direct, right?
Yes.
Okay. And I understand it's your testimony that that wasn't Dr. Weiss because you don't know Dr. Weiss, is that right?
I don't know Dr. Wise.
And then I want to go up when you were asked about did you ever walk to the nursing station? Going up to the ICU, isn't it true, going back to your deposition, that you indicated when you were asked the question, when did Dr. Husel show up? You indicated,
Page, please.
64. You indicated, did you not, he showed up. It was after John, my brother John was there, I believe. And talking to him about that, we need to make a decision and all that. Do you remember saying that, sir?
Sure.
Well, tell me at any point in time if you want to see the transcript to refresh your recollection on how you showed up.
I'm not.
Okay. And then you were asked the question, were you not, did John come in and then ask to see the doctor? And you said, I don't think so. There again, the nurse Jake, as far as I know, called us to my dad's bedside. You went on to be asked, who called Dr. Husel? And you indicated, I don't know who called Dr. Husel. Right, sir? Do you remember that?
I don't know who called Dr. Husel.
And then you just said, I just remember seeing Dr. Husel in the hallway. I don't work for the hospital. I don't know who called who or where Dr. Husel was at any of these things. I don't know. How would I know? Do you remember saying that, sir, on page 65 of your deposition?
Yeah. Yes. I mean,
You talked about your father. I think you were asked about his activities, gardening and otherwise. Your father had a history of a gunshot wound in his left side, which required surgery, did he not?
yes.
And he had been knifed multiple times in the past, which had required hospitalizations, correct?
Yes.
And he had a history of cardiomyopathy, correct?
He had heart disease.
He had heart disease.
Yeah, I'm not a doctor. I just know he had heart disease.
Right. He had type 2 diabetes,
That depends on his weight.
hypertension.
Well, define hypertension.
History of, he had the AFib, the heart issue.
Yeah, he had a pacemaker.
And I was just going to ask you, so he had a pacemaker.
Yes, ma'am.
And you understand, I know you're not a doctor, but a pacemaker.
He had a defibrillator pacemaker.
So it works for your heart when your heart can't work
Yeah, he
for
had
itself.
heart disease.
And he had that pacemaker put in 2 to 3 years prior to his last hospitalization, is that right?
Yes.
He was still actively smoking and he had COPD?
Well, he would smoke and then he'd quit, and then he'd smoke and then he'd quit. And I imagine he did have some form of COPD. I wasn't aware. No one said he did to me personally. But 80 years old and he smokes. I imagine he has.
And I just want to go through, sir, one moment, Your Honor. I just want to kind of go through, I know you said you've named some doctors. Do you know Dr. Joshua Asoma, Asamoa, that would have seen your father on the 28th? Do you know that doctor?
No.
Do you know Seth Hoffman, MD, that would have seen your father on the 28th?
No.
Did you know that prior to the family in this case making the decision to withdraw life support, that Dr. Husel had actually 3 hours prior ordered a surgical referral? Did you know that?
No.
You didn't know that?
No.
So 3 hours before the family makes a decision to withdraw care, you were never told that Dr. Husel was actually still trying to provide care.
No, I would like to state that we just went along.
Stop. Okay. Did you understand her question?
Yes.
Did you think you answered it?
Not completely.
Well, I think you did, so let's move
Okay.
on. Next question.
Yes, sir.
Sir, I think you said in your direct that you had an opportunity to review your deposition prior to your testimony today. Is that right?
Of course.
That deposition, if you recall, was 71 to 72 pages in length. Does that sound about right?
Yeah. Mm-hmm.
And I know you see me ask this, but would you agree that memory doesn't get better over time?
I don't know.
And I ask that because I was sitting over there at council table when I saw you for the jury show this very dramatic motion about how the tube was ripped out.
Yeah, it was pretty dramatic.
In the 72 pages of deposition, or maybe 71, do you want to point me to where you talk about that, where the tube was ripped out like you described it?
I don't think it's on there, but I don't think I was asked.
And so that's why you didn't mention something like that, is because you weren't asked about it specifically?
Well, I was kind of confused. I'd never done a deposition before. I've never answered those types of questions. I was in a situation I was uncomfortable with, and I was answering their questions as best as I could, but I wasn't thinking up questions for them to answer for them.
So I want to go back to that deposition then. You had an attorney present with you that day, right, when you were answering questions?
Yeah, there was an attorney sitting with me.
And you were told, were you not, at the beginning of the deposition, as you've reviewed, that if you had any questions at any time, you could stop and ask those questions, right?
Sure. Mm-hmm.
And you were told, were you not, at the beginning of the deposition, that if there's any question you don't understand, just let us know, and we can either restate the question or rephrase it and ask it again. Do you remember being told that?
Sure. Mm-hmm.
And you were told if you needed a break, take a break. We'll happy to take a break. Do you remember that?
Yes.
Okay. And then do you remember questions that you were asked specifically on page 45 and 46 and 47 and 48 about Nurse J. Dean? Do you remember that?
No.
Don't remember being asked about why you filed the lawsuit? Why your family filed the lawsuit?
No.
Going to. One moment, Your Honor. Again.
One moment, Your Honor, while I find the page. Thank you. And in fact, when the first attorney finished asking questions, there was a break taken, was there not? Before the next attorney started asking questions?
Yeah, my attorney had to use the restroom.
And you indicated during your deposition that you had a conversation with the prosecutor's office after the litigation was filed with your family. Is that correct?
I'm not sure, what are you talking about? I don't know what you're talking about.
You don't?
No, I don't understand the question.
Okay. Did you talk, so let me rephrase it. How many times have you met with the prosecutor's office?
Which one?
There's multiple sets, so let's just include them all.
Well, I mean, we spoke with, it was a group meeting with O'Brien, and I don't know, there may have been one or two. I've met with the prosecutors present here today once, maybe.
And then you spoke with detectives after you had filed the lawsuit, is that correct?
There's a phone call.
And then directing your attention to page 45, you were asked about a nurse's board hearing. Do you remember that questioning on page 45 of your deposition?
Well, I don't remember, but I know that.
Okay. So I just want to make sure that when you talked about you weren't asked the right questions, which is why you didn't talk about this incident in your depo, that you actually indicated in your depo, did you not, that you watched a certain hearing so that I wanted to hear what actually happened at the hospital as far as their records indicate. Do you remember that testimony?
Yes.
And you were asked other questions, were you not, about Jake all throughout. And you mentioned the name Jake a significant number of times, more than 10 times in your deposition, do you not?
If you say so.
Well, you used the name Jake, do you not, sir, in your deposition?
Well, that's how he introduced himself to us.
So you knew his name,
Of
right?
course.
And you talk about what Jake did, what they told you, right? How they treated you, right, sir?
I don't understand.
When you're asked the questions during the deposition about Jake.
Yeah,
Yeah, right?
what?
You talked to them about Jake, but yet today, for the first time, in front of this jury, talk about the ripping of the tube. Right, sir? You've never mentioned that before.
I have, I'm sure I have, maybe not in a deposition,
You've never
but
mentioned
that doesn't mean it didn't happen.
But you didn't mention it in the deposition, right, sir?
No,
And when we talk about what things did and didn't happen, right, I just want to be clear that you understood in your family who possessed the decision to decide whether or not your loved one would remain on the ventilator, right? You understood who possessed that decision.
well, I understood that I was told that my stepmother, Barb Allen, on a phone call, had stated that she wanted us children of my father to make that decision.
Sure. And so then, yes, you understood who had the power of that decision, right?
The power,
Yes. Who owned it? Who had that?
who was responsible?
Yes.
We were as a family.
So then I want to talk to you about something else you said on your rep, about the 20 minutes of the birthday. You were all there. I want to go back to where we began. Everybody in the room circled around your father. You
would describe yourself as how would you describe yourself?
How would I describe myself?
Okay.
Sorry, I won't withdraw that. Let me ask this, sir.
Might be a little bias on that answer. Yeah.
You are a man that seems to speak his mind. Would you agree with me on that, sir?
I claim to be a man that speaks his mind.
And you were in that hospital that night with your family, right?
Well, of course.
And I presume, given the closeness of your family and your testimony, that if you had said something to your brother or your sister had said something to you that you disagreed with, you would have spoken.
Well, yes.
And while you were in that hospital together as a family and the decision was made, you all had time to gather in the room? Is that right?
We always had time to gather at the room. We were asked for a moment to step out of the room when he unhooked the meds and pulled the vent tube. But we were always allowed to go be in the room with my father.
So wait, I'm curious about that, sir. I think you just said to the jury, you were asked to step out of the room.
I just
when the
told you
tube
that.
was pulled out,
Sorry.
right?
For a moment while he did that.
So you actually didn't see the tube being pulled out,
Yes, I seen it.
but he asked you to step
I
out.
wasn't in there, but I looked through the crack in the curtain. He wasn't there. You didn't see
Okay,
what
relax for a
was
second.
going on,
Let's
you know?
ask the next question.
Well, she's being,
Stop.
trying to lead.
Stop.
Sorry.
Any other questions?
No, Your Honor, thank you. Nothing.
I
Redirect.
apologize for that.
Redirect, Your Honor?
Yeah.
Thank you. Good afternoon again to everybody. Were you present for conversations with Jacob Deemer?
Yes,
Were you present for discussions with William Husel?
yes.
Did anyone at the deposition tell you that you could just volunteer information?
No,
Nothing further.
Okay, you can step down. Thank you.
thank you.
Call your next witness.
Your Honor, before we call the next witness, I'd like to approach.
I'm just trying to size you up over there. Is this going to be a quick approach or a long
I
approach?
hope it'll be quick. Thanks, Jim.
Okay, you guys, Mr. Pedicus, go ahead and entertain them for a second. That's a starting point. Knock it out. Ask for a full.
Yes, she does. She does. She seems like that. Just like that, she goes, great job. It was an expensive surgery.
It's not supposed to get this.
Have we? You get like more than late after.
You chicken out?
No, I didn't want to get on.
You didn't get it on camera?
No, next one. I'm confident there'll be a next one.
Okay, let's call your next witness. What?
I need a moment. I know.
Okay. How long's a moment?
60 seconds. Thank you.
I'm not gonna make you get up for 60 seconds. Okay? Nah, he's not, they've been trying to get him to juggle. I'm not gonna subject the jury to him juggling. We don't have a protective glass in front of him anymore, so.
There's implied consent.
Okay. Sorry, Your Honor, I apologize.
Okay, you ready? Call your next witness.
Thank you, Your Honor. The state would call Sarah Burnham to the stand.
I need you to remain standing and raise your right hand, please. You swear to affirm and tell the whole truth and nothing but the truth, so help you God.
I do.
Please be seated. You can make yourself comfortable. You need to scoot in a little closer. And you'll be so kind as to state your name for the record and spell your name.
Okay. My name is Sarah Marie Burnham. It's SARAHBURNHAM.
You guys hearing okay?
Yes.
Okay, proceed.
All right.
Speaker.
Thank you. Ms. Burnham, where are you from?
Here in Columbus, Ohio.
You've lived here your whole life?
Yep, born and raised.
And what is it that you do for a living?
I work for Ohio Health as a phlebotomist. I
A
have
phlebotomist?
Yes, I draw blood.
Do you mind spelling that just in case for Sam here?
I believe it's PHLEBOTMIST.
Okay.
Yeah, phlebotomist. I
And-
might have spelled that wrong, sorry.
Do you mind explaining to the jurors what a phlebotomist is?
Yep. So basically, I go around. I get an order from a doctor to draw blood tests, and then I go and I get the test from blood, or get the blood, put them in tubes, and then take them down to the laboratory.
And how long have you done that?
Since 2016.
Now, you said your last name is Burnham.
Correct.
What's your maiden name?
Castle.
So then are you related to Miss Sandra Castle?
Yes, she is my paternal grandmother.
All right. And back in 2018, how often did you see your grandmother?
2018, probably like on a monthly, bi-monthly basis. I had just had my son in January of that year. So we weren't able to get over as often as what we normally did, but it was still pretty regularly that I would see her.
And what types of things would you do with her?
Just go over for dinner. I take my kids over to go visit with her. Just visit. I mean, nothing really out of the ordinary. We'd sit around and talk. Just things like that.
What do you remember most about your grandmother?
Probably just how much she loved having a family, being a grandmother. I was her first. I was the first grandchild. So she just was very doting, very loving. just remember her enjoying having a family. That was probably one of the most important things to her.
Now, in 2018, was your grandmother hospitalized
Yeah, several times.
several times?
Mhm.
Do you know what types of ailments caused her to be hospitalized?
In 2018, I do believe she had a pacemaker installed. So she was having issues. She had AFib. She had been diagnosed with AFib, but she had a lot of comorbidities. She had obesity. She was diabetic. She had kidney issues. She had COPD, among the list of things. So.
All right. And how about November of that year? Was she hospitalized?
Yes. The first instance that I was aware of, she had just went into the hospital because she had been having tremors. And so they were trying to go to find out why she was having those tremors. And I believe that was right before the hospitalization that resulted in this.
So this was not her last hospitalization that you're currently speaking about?
Correct. Yeah, it was prior to her last hospitalization.
Do you know what date her last hospitalization began?
It would have been November 9th because it was the same day that I had my wisdom teeth removed.
Okay.
So that's how I remember.
And how did you become aware of the fact that she was in the hospital?
I had awakened in the middle of the night because I had gotten home from my procedure, went straight to bed to sleep off the anesthesia. So it was probably about 2 or 3 a.m. when I woke up to a text from my father, who lives in Florida, but he had texted me and let me know that they had taken grandma by squad to the emergency department at Mount Carmel.
And you say 1 or 2 a.m. on the 9th?
No, it would have been the 10th then. Because she was taken in the night of the 9th, which was Friday night. And then so it would have been early Saturday morning when I received the text.
All right. And then what did you do next?
So then I let my husband know. We were able to arrange to take my children to my mother's house so that we could go and visit my grandmother in the hospital just to kind of visit, but also see what situation she was in. I was also going to see if my father needed to come up as well too, just to kind of judge the whole situation that she was in.
All right. And then what did you find when you got to the hospital?
She was intubated. My aunt was in the hospital with her when we arrived, my husband and I. She had cooling blankets on her. And from my understanding, they were doing therapeutic hyperthermia because they were unsure if she had a cardiac issue or if it was a brain issue. So they were just trying to, I guess, policy was to have that therapeutic hyperthermia.
And how long were you there on that day?
An hour or 2 tops, just long enough to see that her condition wasn't good and that let my father know he needed to come up from Florida ASAP.
All right. And then what happened after that?
After that, you mean as far as that day or?
Yes. If anything else happened that day, either while you were in the hospital or otherwise?
Not that I'm aware of. I mean, we had a staff member come in and was taking care, but didn't really say much to her, ask besides, why the cooling blankets, what that was. And that's how we, discovered they were cooling her down for the protocol.
Okay,
And-
you gotta help us out because you started talking faster there.
Sorry.
And I didn't know if she got it and you
Okay.
were moving your hands, you got quieter.
Okay.
Remember what you just said?
Talking about how there was a nurse that had come in and basically we were asking her about the cooling blankets and the therapeutic hyperthermia, but that was about it.
Okay.
And you said your aunt was there at the time?
Yeah, my Aunt Debbie.
Was there anyone else there?
Not that I remember. I don't know if my uncle may have came while we were there, but I definitely remember my aunt being there.
Okay. And then that was on the 10th, correct?
That was on the 10th, correct?
All right. Did you return at all on the 11th?
No.
What about the 12th?
No.
And what about the 13th?
The 13th I did, yes, because that's the day that we were told she was being extubated.
You were being told by who?
My father had called me and said that they had located her advance directive, and that they were honoring her wishes and taking her off the ventilator. So they had planned around, I believe, 3:00 for all of the family to gather there so that we could say our last goodbyes, and then they planned on excubating her after.
Okay. Do you know what time you got to the hospital then on the 13th?
It would have been between 3 and 3:30 because I had left work that day and typically got off around 2 or 2:30, and I had worked up at the Grady Hospital there in Delaware.
All right. And
Grady Memorial in Delaware.
what did you observe when you got there?
When I first walked in, we were all waiting to go back. So I just walked into the waiting room and met up with my aunt and my two cousins, Ashley and Bradley, which are her children. And then Bradley's, I believe it was his fiance at the time, or maybe his wife. I think it was his wife, Jamila. And so we just sat there, waited for more family members to come, and then we're waiting on to be told that we could come back.
Okay, so you're waiting in the waiting area at this
Yes.
time. And what happens next?
So then everyone arrives, we get taken back. It's probably maybe about an hour after I got there. So 4:30, we were back there. We were told that they were going to extubate her. So they came into the room. All of us were still in there. We were not asked to step out, and they continued to remove the tube from my grandmother with all of us in the room.
And were you present for any of the conversations regarding and your family approach medical staff asking for anything or asking for any comfort care?
Not to my recollection. I did not. I didn't witness my uncle or my dad either. So not to my knowledge.
Did you see any signs that she was in any pain?
To me, no. She just kind of, she was unable to hold her head. So her head was over to the side, kind of propped up by pillows. Other than that, she was real stiff. Her mouth was open. But I mean, as far as like grimacing or reactions to pain or anything like that, if you would hold her hand or you would, you know, squeeze her nail bed, she wouldn't have any kind of reaction to it. So in my eyes, I did not interpret her being in any kind of pain.
All right. And did you have any interaction with Dr. Husel that evening?
Yes.
Can you please tell me about that?
Probably about, I want to say it was around 10 or the 10 o'clock hour. He did happen to come into my grandmother's room. He had another, I don't know if it was an attending, another staff member with him. Basically just talked to us about her death rattle, how loud it was, being able to give her something to quiet the death rattle to make sure she's comfortable.
And had anyone gone and talked to him prior to this, that to your knowledge?
Not to my knowledge, no.
What happened after he came into the room and said this to you?
So we discussed it. We accepted and agreed that, you know, she needed something to make her comfortable for the death rattle. So I'd say maybe 20, 30 minutes later, Stephanie then came in. It was a large vial, and it was filled with white, clear fluid, or not clear, white, kind of viscous, cloudy fluid. She administered a little bit of it, paused, and then administered the rest.
And you say large. Mm-hmm. Do you know about how large it was?
To me, it looked like it might be like a 20 cc or 30 mLs, like not like the smaller standard syringes that I'm used to using when I draw blood.
And you're familiar with the sizes of syringes because of your employment?
Yes, correct.
And why is it that you noticed this particular syringe?
Just the size. Everything before that had been pre-measured. Like, I don't know if they're little pre-measured morphine vials, but everything was a lot smaller. She was able to carry like 3 or 4 in at a time in one hand. And this one, it was rather large. It was the only one she carried in, and it was a good amount of this white fluid that just kind of stuck out against anything. So going from those small sizes to that very large syringe was definitely something that stuck out.
Prior to walking in, did the doctor tell you what they would be giving her, or did Stephanie tell you what they'd be giving her?
No.
Now I have what's marked as States Exhibit 28A. Your Honor, may I approach? Can you please, for the record, tell us what this is?
So this would be a 30 ml syringe.
And is that the size of the syringe that you saw Ms. Lachard use?
It looks very similar to it, yes. Yeah.
This isn't the exact one, to be clear, correct?
Yes, this isn't the exact one, correct, but it was about that size, yes.
And after the medication was administered by Ms. Lachard, what happened next?
So then we just kind of sat there and watched Grandma. Her breathing became more irregular. She would have periods where she wouldn't breathe, and then periods where she would. And at one point, they were sitting there coming in and checking her vitals every so often just to monitor her. And I believe at one point, she didn't take a breath for about 3 minutes. So they went to go in to listen to see if they could call it. And she took a real, like a gasp of breath, and then kind of continued to breathe. And then that would become more and more frequent, her long periods of no breathing.
Did you notice anything else about her other than her actions, anything about her appearance or anything?
Her fingertips had started to turn blue. She got the blue forming around her lips. I know at one point the other nurse, not Stephanie, but the male nurse came in and told us that her O2 sats were like in the 50s, so that she was kind of slowly deteriorating.
And how much time, you said they would come in every couple of minutes. So how much time from the administration of that medication was it until you were told that she had passed?
I'd say probably about a half hour, because they came in, it was close to 11 when they administered it, and then it was, I believe, 11:23 when they pronounced her. So I'd say maybe 30 minutes after administration.
First of all, I'm not sure if this is on. I'm going to show you here what State's Exhibit 12A. Can you tell me what this is?
It's a picture of my grandma, Sandy Castle, or Sandra Castle.
Thank you. And at the time that this happened, when you were there with your grandmother, was there anything that was odd to you about the situation?
Not really. No, I mean, it just appeared to me like she was taken off the ventilator and was progressing, I guess, as normally as I had seen.
And you said as you had seen.
I never had actually seen anybody die up close. She was my first person I actually saw die. But to me, it didn't seem anything out of the ordinary, I guess. I mean, I knew that death rattle occurred when people were dying. I mean, I knew that was a thing, but other than that, I don't really think there was anything to me that stuck out.
And you're speaking about the death rattle. Was that something that was upsetting to you and your family?
I think my dad might have been more distraught with it. I mean, just because that was his mother that he was watching kind of die in a horrific way, which, you know, we did not want her and she did not want to die. But no, I mean, it didn't really strike me as odd or bother me.
Were you bothered by the size of the syringe?
I definitely remember just kind of thinking like, wow, that's big. Yeah, I mean, because it definitely stuck out in my mind. I mean, we just went from the small little pre-filled ones and then all of a sudden jumped to this huge syringe full of medicine. So it did, that struck me as odd. That's why I still remember it.
Your Honor, do I have permission to show the jurors as a demonstrative purpose the syringe that I presented to her?
No, if it goes back, they can see it then.
All right, thank you. No further questions.
Cross?
Good afternoon. Diane Menashe on behalf of Dr. Husel. Are you still a phlebotomist?
Yes,
Just want to make sure that I'm clear. Fair to say as a phlebotomist, you do not administer medications.
correct,
You draw blood.
correct.
So it's from that perspective that you were talking about some medical terms during your direct examination. Is that fair to say?
Correct, yes.
As a phlebotomist working in healthcare, I'm assuming that you're aware of day shift and night shift times.
Correct,
Night shift starts at 7 p.m., does it not?
correct.
Your Ms. Castle was extubated at 16:42. Does that time sound familiar to you?
Yes,
And 16:42, that's military time. Would you agree with me that that's 4:42 in the afternoon?
yes, I would.
So she's extubated and the decision is made because of her advanced directive during the day shift.
Correct.
So then we have the night shift beginning at 7 p.m.
Correct.
Do you remember how when the shift change took place, there was a change in nursing staff?
Yes.
You mentioned Stephanie. Stephanie was the night shift nurse that was there.
That is correct.
Fair to say, and I take it from your testimony that Stephanie was tending. She was present.
She was present, yes.
She was in and out of the room.
Yes.
If there was a time when you needed her, she was accessible to the family.
Yes.
And so much so you actually remembered her first name. It seems like.
Yeah, she was very personable with us, very compassionate. She even, after my grandmother had passed away, when we were leaving, had taken the time to come over and hug and cry with us. So, yeah, I was very touched by it.
And then I want to talk about, in terms of timing, your testimony with respect to the syringe. I know you don't administer medications, but I wanted to make sure I wrote down what your testimony was. I think first you said in the syringe it was cloudy, and then you indicated that it was white fluid. Is that accurate, what you said in your direct?
Correct. Yeah, it was white, cloudy, viscous fluid.
Would it surprise you to know that fentanyl is completely clear?
Sure. Yeah, I wouldn't know.
Then let me ask you this. Did you know that 30 minutes plus or minus before the fentanyl was given, that glycopyrrolate was given to help with the death rattle and the secretions? And that medicine, would it surprise you to know, was clear?
Oh, okay. Yeah, I wouldn't know that either.
But do you remember that there was first the medication given as ordered by Dr. Husel for the secretions and the death rattle?
I remember discussing that being the reason that we were going to give the medication to her was to dry the secretions that would help with that death rattle, yes.
And at this point in time, we've got the extubation at 4:42. We're now nearing 11 p.m. at night, 10, 11 at night.
Correct.
So long that you even testified on direct that some family members, and I don't mean to be disrespectful, were getting tired of waiting and it actually left at that time.
Correct.
And so the family members in support were narrowing because it was taking many, many hours for Ms. Castle to pass. Is that right?
Correct.
And I know it didn't bother you according to your testimony, but fair to say that your father was quite disturbed.
Yeah, he was very distraught watching the way that she was dying, yes.
By the noise, right? It was loud.
To me, it didn't seem loud. I mean, I was sitting at the bedside with her. My father was on one side, I was on the other. It was loud, but I wouldn't say it was. I wouldn't say it was something where you'd have to put earplugs in or, would be a high decibel or anything like that. I mean, it was, to me, it was a normal level, I guess. I mean, I didn't have anything to compare it to, but it wasn't anything that was, like a jackhammer hitting a pavement or something like that.
But there was a death rattle.
There was a death rattle, yes.
And I know how the impression it left on you, but in your opinion, the impression it had on your father was that he was very disturbed by it.
Yes.
And even fair to say, when he first saw the ventilator, like he was disturbed that there was even a ventilator, even period, right?
I don't know if disturbed would be the right word. I think angry would be a more appropriate word, just because it was well known she did not want to be on a ventilator.
And I know, and I know you were asked about this in your deposition, and your father's reaction when he first saw her. You mentioned that there was some concern or frustration, you mentioned that he was upset and frustrated with the fact that his mother was on life support because she had been clear that she didn't want to be on life support, period.
Correct.
not just that she didn't want to remain in a vegetative state, she didn't ever want to have a tube and be on mechanical ventilation, right?
Correct.
And your father, based on your observations and knowing of the situation, very well knew that about his mother.
Correct.
And I know you talked about her prior health conditions, but I just wanted to kind of go back, if we could, a little bit. She had had some serious health conditions for some time.
Correct.
And I know that you listed them, the COPD, she was morbidly obese. I don't say that as a criticism.
Right. Yeah.
She obviously, the dysfunction in the kidneys, so the failing in the kidneys. And she had taken a bunch of medication that was giving her some side effects as well.
Correct.
And then she had the surgery on her lower back. And when you were talking on direct examination about her coming into the hospital, I just want to make sure that I understood. You're aware, are you not, that she actually came in on the 9th to Mount Carmel West? She was released on the 10th, went home, and then 4 hours later actually coded and then was brought back. Did you know that?
That would have been on that Friday, which I believe was the 9th, was when she was in Thursday night into Friday morning.
Okay.
And then Friday morning is when she was released. And then that Friday night is when she was brought back to the ER.
Okay. But it's within a 24-hour period that she's actually released, goes home, and then she codes.
Correct.
And then she's brought right back
Correct.
to the ER and then ultimately to the ICU.
Correct.
When she coded, was she given CPR, if you know, at home?
I do believe she was given CPR. I believe she was shocked as well too. I do believe they had to shock her several times to get a pulse back.
And this was even before she was just brought back to Mount Carmel West the last time.
Correct.
I just want to go over a few things and then be done. With respect to your conversations with Dr. Husel, I know you talked about those on direct, but the conversations with respect to Dr. Husel were about providing medication to provide comfort to your grandmother. Is that fair to say?
Yes.
And then your testimony is that medications were given once or twice, but medication was thereafter given. Is that right?
Correct. After the discussion with Dr. Husel. Yes. I'm sorry. Oh, yes. Yes. After the discussion with Dr. Husel. That's correct.
And I just want to make sure that in terms of Dr. Husel's, presence, he came to the room to check on your grandmother, did he not? And indicated that the reason he came to the room was because of the death rattle.
That is correct.
And the noise that it was making, and then there was the discussion about medication that could be given.
Correct.
Prior to that conversation that took place, the decision to palliatively extubate your grandmother was during the day shift. It had nothing to do with Dr. Husel, correct?
That is correct.
And if we just talk about 10 or 11 p.m., the night shift beginning at 7 p.m., there's 3 to 4 hours before Dr. Husel even comes to the room to speak with the family.
Correct.
One moment, Your Honor. A few other questions. One moment, Your Honor. I just want to find something if I could. You were asked some questions about what, if anything, you saw in terms of, I know you said grimacing or agonal breathing. Just want to go back. You were deposed in this case.
Correct.
And during your deposition, if you recall, you were asked if once the vent was withdrawn, if your grandmother was ever breathing on her own. And you remember you saying you didn't know.
I believe so, yeah.
And then you were asked if you witnessed her heaving or gasping, what they would call agonal breathing, once the vent was withdrawn. And you indicated back in your deposition on 12/18 of 2020, I believe so. Do you remember saying that?
Yes,
So there was agonal breathing.
yes,
And there was a lot of phlegm, as you said, during your deposition.
yes,
A lot of sounds coming with her.
yes.
And though I know you testified about whether it was pain, did you not indicate that she had a lot of jerking motions as far as her head and her neck and the way she was breathing?
Yes,
And then you said you did see that.
I did see that, yes,
And this went on into the night.
yes. I didn't interpret it as pain, though. I just interpreted it as normal for her situation.
And when you say normal for a situation, and I don't mean to be crass in asking this question, but because we've never experienced the process of dying, would you agree that none of us know if it's really painful or not?
Right. I would not say I know if it's painful or not.
Nothing further. Thank you, Your Honor.
Redirect.
Your Honor.
Sorry?
Reproach.
Sure.
your grandmother, had you all accepted the fact that she was dying?
Yes.
And the noises, this death rattle you were speaking of, you were in the room with her the entire time you were there, or did you leave it all?
No, I was there with her the entire time.
And you didn't complain to the nurses about the noise?
No, I did not personally.
Did you want your grandmother to be comfortable as she was dying?
Yes.
Did you want her to be euthanized?
No.
Objection, Your Honor.
Sustained.
Move to strike that.
Strike, disregard the last question and answer.
I'll withdraw. Nothing further, Your Honor.
Okay, let me step down, ma'am. Thank you. I think that's all the witnesses the state had today.
That is correct, John.
Okay, let's talk, ladies and gentlemen of the jury. Let's let her get out the door or out the area. If I misstate something, it's my understanding you have a couple witnesses tomorrow morning. One witness tomorrow morning, and that'll be your last witness.
That's correct, Your Honor.
Okay. What's going to happen tomorrow, ladies and gentlemen, is the state will finish their last witness. At that point in time, we'll have to take a recess for a while. I've got some judges stuff to do with this case. Okay, so it's going to take the better part of the afternoon. So you'll just be in the morning for the one witness. And I'm going to probably have you excused for the rest of the day, and we'll continue back up on Wednesday. Okay? And there's just no way I can solve that problem. So I'm just being honest with you. You know, you can make it, you might be able to make afternoon, well, don't make afternoon plans. It's knowing my luck, it won't go that way. But I'll have to do some stuff tomorrow. So it may be a while. So instead of you sitting back there the rest of the afternoon, I'll probably send you home and we'll get started back on Wednesday. Okay? Any questions? Okay. David?
All rise.
Have a good evening, guys. Remember the admonition. Be safe. At least we'll have the smell of the coffee in the morning. Yeah. Okay, you can be seated. I just felt it was appropriate to discuss that with the jury. We're going to be the afternoon going through exhibits and motions. So I couldn't see keeping them here. I'd rather have them fresh the next day instead of waiting back in the room.
No objection from the state.
Any problems from the defense?
No.
Okay. Anything for the record there, Ms. Booker?
No, thank you, Your Honor.
Ms. Menashe? Anything for the record?
Yeah.
What would you like to discuss?
I do think that the comment that we discussed at the sidebar with respect to this witness and what she said, that it's my understanding that when she was being interviewed by the prosecutor's office, and I'm sure they will correct me if I'm wrong, but she indicated that Dr. Husel had told her and the family that he would be willing to provide comfort, medicine that would give comfort, but a side effect could be that it hastened the death. I think that's actually Brady information. And so I would just say that we were never disclosed that statement. I understand that the state has indicated they intentionally didn't elicit it because obviously the statement comports with our theory of the defense, that he actually indicated side effects, and that they still wish to proceed forward. I would just put that on the record that we weren't given a summary that of that statement.
Okay. I'm concerned about the allegation of braiding material. I'm trying to figure out how it's braiding material.
Well, how it's braiding material is that here's a doctor that's saying, I can provide comfort care. That would be my goal, is to provide comfort care.
That isn't what was said, but I understand you have to make an inference from there to get there.
I don't think you have to make a difference from there.
He says he can give her comfort, but it'll hasten her death.
A side effect could be that it would hasten her death. That's the doctrine of double effect.
Okay.
So I do actually, okay.
I'm still not getting there.
Okay.
Okay, I'm trying to understand because as I understand this case so far in the testimony, it's down to intention, and you can call whatever metaphysical thing there, but it's still down to his intention at the administering of the dosage.
No, it's intent and causation.
Yeah,
Okay. It's both, right? And he has to intend to hasten the death, right? And then the
well, he
medication.
administered it knowing that it would hasten the death is what that statement says.
Well, that's the doctrine of double effect, Your Honor, is that it's like, talk about the biopsy surgery that goes bad and then she bleeds out. One of the patients in this case. Sometimes you do things, and if your intended goal is X, and a consequence other than intended goal Y happens, that's the doctrine of double effect.
No, I disagree with your analysis there. I'm trying
Okay.
to get there. I'm not giving up on the issue on it. I don't think it's braiding material. It would have been nice for it to have been disclosed ahead of time. Okay, because I think I'm gonna get an attempt at recall. But, okay, anything else to the record?
No, Your Honor, I mean, this was something done during trial preparation. I assume, and perhaps wrongly, that the man sitting next to them can tell them what he said to things. So I don't see why anything that people say he said should somehow obligation, oh, did you know your client said such and such and such and such? And we did, which is our right, which under the rules is, we do not solicit from witnesses his exculpatory statements. I mean, we do that in every case where, as is our choice. So it was just Ms. Menashe's questioning and the witness answering part of what he told her, which is not what we intended, which is not what we solicited. I felt for completeness, that witness, that the court should be aware that there's a second part to that statement. That's why I disclosed it.
For the record, Your Honor, the brother did indicate that conversation happened, but of course the state chose to present their case as they're completely allowed to do. And so I had no indication that this witness knew of that conversation. I just put it out there. We have the ability to subpoena witnesses. Of course, we don't have a burden of proof. And so I like to cut down on that as much as possible because we have no burden whatsoever. I will say though, with respect to that, this issue that was addressed today, we do intend to address it in our case in chief. I have issued a subpoena. We intend to have the witness up there to play the tape, ask her to identify herself and mark it.
Okay, are we talking about something different than the last witness?
We are, Your Honor, just in circling up on witnesses that we intend to call in our case in chief.
Okay, so we got a witness you intend to recall. Which one?
The woman from this morning, Beverly Leonard.
This morning?
I'm sorry. When I said this morning, Your Honor, I meant
You're talking
the
about the woman
video
with
and the pill bottle. That's correct, Your Honor. I served
And
the
you
subpoena.
tagged her with a subpoena?
I did, Your Honor, and we filed it as well. I just wanted to be transparent about that, and I told the state in advance of me going to serve her. I personally served her.
Okay. Any objection?
No objection to him personally serving anyone, Judge. I thought you were still deciding on what to do on this.
No, I'm still working there.
All right, so I just, the only objection I have is Ms. Menashe assuming she's making decisions. Thank you.
I don't think that's what's her intention.
Well, I mean, you say, we're going to figure, I still have to think about what to do on this, and she's just telling you what we're going to do on this. That would be my only objection. Thank you.
Okay. Anything else to the record?
No, Your Honor.
Let's get started at 9.
very careful. Everything back.
Uh-huh.
Nothing is
Oh,
full
my
of.
God.
Hey, we got a mark. Say this is the exhibit S. What was the court's exhibit number for Dr. Ross' report?
11, 12, 13?